On
This
behalf of
conference will
International
now be
Society
recorded.
for Waste Management Air and Water ISWMAW, South Asian Cooperative Environment Programme Sri Lanka SASEP, the IGES Center collaborating with UNEP on Environmental Technologies CCET, I Iptita Shaha welcome all to the webinar on waste management in post-COVID-19 scenario in South Asian countries. I hand over to Dr. Sutripta Sarkar to proceed further.
Thank you, Ms. Ipshita Shah. A very good morning to all. With the backdrop that the whole world is witnessing an unprecedented situation with the disease evolved from the pandemic outbreak of novel coronavirus, COVID-19, the South Asia Cooperative Environment Program, SASEP, in collaboration with International Society of Waste Management, Air and Water, ISWMAW, and the IGES Center collaborating with UNEP on Environmental Technologies, CSEP, is organizing the webinar today. The objective of the webinar is to discuss various issues related to the protection of people and environment from the effects of COVID-19 that will be addressed by the experts and officials from the countries in South Asia. We are very glad to announce that more than 418 participants from 24 countries actually registered and participating from Afghanistan, Bangladesh, Bhutan, Brazil, Cambodia, Egypt, India, Italy, Japan, Kenya, Lesotho, South Africa, Sri Lanka, South Korea, Maldives, Morocco, Nepal, Nigeria, Norway, Pakistan, Philippines, Thailand, Turkey, United Kingdom, and United States of America in the webinar through the webinar platform and Facebook live streaming. SASEP and ISWMAW. We are pleased to inform you that we have a group of very distinguished experts and speakers in this webinar. I like to inform all that the participants who are registered and attending the webinar through GoToMeeting and Facebook live streaming will be given certificates of attendance as per our database. I like to make two announcements on behalf of ISWMAW. The first one is that the 10th International Conference on Sustainable Waste Management towards Circular Economy, that is the 10th Icon SWM-CE 2020, during December 2nd to 4th, 2020, will be held at Kolkata, India. I cordially invite the participating delegates to submit articles and join the virtual physical conference. Date of full article submission is 31st August 2020. Details will be sent to you in mail and is available in our website www.iswmaw.com. The second important announcement that a COVID-19 compendium entitled COVID-19 Countermeasures will be published soon. We cordially invite you to contribute chapters. The interested authors are requested to send your willingness with your biodata and an abstract of 250 words before 31st August. The article has to be submitted by 30th October 2020. Kindly note that all participants in the webinar remain in default mute mode. Speakers unmute only when requested. Questions and queries may be asked in the chat box, which will be handled by our rapporteurs and session moderators. On request, the camera may be put on, else it will be off. I am pleased to request Dr. Abbas Basir, Director General, South Asia Cooperative Environment Program, SASEP, to deliver the welcome address. Dr. Abbas Basir, Director General, South Asia Cooperative Environment Program, SISEP. He worked as a senior advisor to the Afghan president on natural resources and environment at the ministerial level. He was lecturer in environment and water management in Afghanistan at different universities. He also worked as acting director, International Cultural Relations Directorate, Ministry of Foreign Affairs, Afghanistan, DDG of National Environment Protection Agency, Afghanistan, and Chief of Staff, Afghan Vice President Office, and served as Afghan diplomat in India. He represented Government of Afghanistan as the head and the member of the delegation at several international conferences, including climate change negotiations, GEF Assembly, SAARC intergovernmental meetings. He has written 3 books and more than 200 articles in the field of environment law and policy. Dr. Abbas Basir, kindly unmute and share the PPT, and the floor is all yours now.
Thank you.
Dr. Abbas Basir. Yeah.
Am I audible?
Yes.
Yes,
You are
sir, you're
audible.
audible.
Thank you. Excellencies, ladies and gentlemen. Good morning, good afternoon, and good evening. Welcome to webinar on waste management and post-COVID-19 scenario in South Asian countries, organized by SAFEB in collaboration with the IGS Center, collaborating with UNEP on environmental technologies for the active collaboration and response to COVID-19. Ladies and gentlemen, this unfortunate pandemic COVID-19 has provided an opportunity to reassess our action for nature. On the one hand, we have seen a visible decline on various types of emissions, including greenhouse gas, due to shutdown took place in the countries. This shows that our positive behavioral change can lead to big wins for clean air and greenhouse gas emissions reduction. On the other hand, we have seen an alarming increase in plastic waste and a substantial decrease in plastic recycling. Sources of the new stream of plastic waste are related to the use of plastics for medical purposes and packaging. During such an outbreak, many types of additional medical and hazardous waste are generated, including infected masks, gloves, and other protective equipment, together with a higher volume of non-infected items of the same nature. Unsound management of this waste could cause unforeseen effects on human health and the environment. Sadly, single-use plastics can take up to 450 years or more to degrade, causing trouble for our oceans and seas. And if current trends continue, we could soon end up with more plastic than the fish in the seas. The safe handling and final disposal of this waste is therefore a vital element in an effective emergency response. The safe management of household waste is also likely to be critical during the COVID-19 emergency. Medical waste such as contaminated masks, gloves, used or expired medicines, and other items can easily become mixed with domestic garbage, but should be treated as hazardous waste and disposed of separately. This should be separately stored from other household waste streams and collected by specialist municipality or waste management operators. Effective management of biomedical and healthcare waste require appropriate identification, collection, separation, storage, transportation, treatment, and disposal, as well as important associated aspects including disinfection, personal protection, and training. Many countries are yet to develop environmentally sound management of waste, including recycling. This mismanagement will put enormous pressure on terrestrial and marine environments. We have seen many images of pandemic-related plastic waste thrown all over land and marine environment, including masks and gloves. In most parts of South Asia today, just 44% of waste is collected. This is one of the lowest rates of waste collection in the world. And even where waste does get collected, the history does not end there, because South Asia also has the world's highest percentage of open sites where most domestic waste gets dumped. To make matters worse, dumping, both legal and illegal, often takes place along waterways and floodplains, seeping into rivers and canals, and from there into the open seas. First response is focusing on raising awareness on pandemic-related waste, to raise awareness and to prepare for managing waste effectively, manage the waste and control the spread of pandemic, and to treat waste in an environmentally sound manner. SOCEP is supporting different aspects of waste management, strengthening regulatory framework, enforcement, waste management strategies, including 3Rs and AIR, based on integrated waste management mechanism. We have adopted regional marine litter action plan and the South Asia roadmap for sustainable waste management and resource circulation. And more recently, on World Oceans Day 2020, we also launched, in collaboration with the World Bank, a first of its kind project that seeks to combat plastic pollution in South Asia's rivers and seas. The $50 million World Bank and partly supported plastic-free rivers and seas for South Asian project is unique in breadth and scope. This project will help to make businesses more circular so that materials can flow constantly in a closed loop rather than being used just once and discarded. And this way, plastics can continue to be used in the economy without harming the natural environment. Furthermore, we are collaborating with IGS to develop guidelines on COVID-19 waste management. SOCEP is involved in this process as a sub-regional partner. I hope this dialogue will help us to start discussions leading to creation of knowledge to support member countries in managing their waste in a sustained manner during the COVID-19 pandemic and post-COVID-19 response period. I wish you a very successful deliberations. I thank you all.
Thank you, Dr. Abbas Wasi. Kindly mute. I hand over the microphone now to Ms. Priyankari Alexander, Program Moderator of Session 1. Priyankari, please unmute your microphone and start the session. Priyankari, are you there?
Thank you, Suprita. Good morning to all the speakers, country representatives and experts, and all the participants who are here from 24 countries. In order to start the proceedings of the day, may I request all the representatives who are here from SOCEP member countries, followed by the experts who are present here, to introduce yourselves in the alphabetical order of the country names. Kindly unmute your microphones one by one and turn on your camera so we all could see you. Starting from Afghanistan, please.
Okay, dear.
Afghanistan.
Hello.
Yes, we can hear you.
I hope it's audible.
Yes, you're audible.
Okay. Sorry, I couldn't hear. It's audible, but it's audible.
Yes, you're audible. Afghanistan.
Yes, I'm here. Ayaz Ahmed.
Okay. We have 3 representatives here from Afghanistan. Can we hear from the others as well? Okay. If they are not here, let's hear from Bangladesh.
Good morning to everyone. This is Porimol Singh from Ministry of Environment, Forest and Climate Change.
Good morning.
Can you hear me? Good morning.
मीटिंग में बुला लेना छोड़ दे हम तो कर लेते हैं Please go ahead. The next person.
We have 2 other colleagues.
Bangladesh, Mr. Lutfur Rahman, I can see you. Bangladesh, Lutfur Rahman, I can see you. Okay. Bhutan, Bhutan. India, India. Okay, it's not here. Nepal.
Rajesh Khan
good morning.
West Bengal.
This is Mandari from Nepal. Good morning, everybody.
Good morning to you.
Yeah, okay.
Good morning. I am Shankar Paudel from Department of Environment, Nepal. Thank you.
Okay. Pakistan.
Yes, I'm Fayad. My name is Fayad Ahmed and Deputy Director in Ministry of Climate Change. My colleague is with me, Mr. Kamran Rashid.
Okay. Sri Lanka.
Yeah. Can you hear me? Yeah, good morning to you all. I'm Sarojini from Central Environmental Authority, Director Solid Waste Management.
And
Okay.
yes, and we have one representative from UNEP Rope as well.
Good afternoon.
Yes, good afternoon, Mr. Mushtaq. We can hear you.
Hello, can you hear me?
Yes, Mr. Mushtaq, we can hear you.
Okay, good morning everyone. This is Mushtaq Memon, Regional Coordinator for Resource Efficiency from UNEP Asia Pacific Office in Bangkok. Nice meeting you.
Welcome to the webinar, Mr.
Good morning,
Mushtaq.
good morning, kisa hoche?
Yeah, and we have representatives from
লেখাগুলো
CCET.
আছে ছোট ছোট ছবি ছোট ছবি দেখা যাচ্ছে
Mr.
Excuse
Onagawa.
me, Priyankari, kindly mute all the participants. Please kindly mute your microphone, only excepting the person who is speaking. Kindly mute your microphone. Please mute your microphone. Yeah, Priyankari, go on.
Yes, Mr. Onagawa, please introduce yourself.
Thank you. This is Kazuo Onogawa from ICCET. Nice to meet you.
Dr. Prema Kumara. Okay. Professor Ghosh, you may also introduce yourself.
Very good morning and namaskar. This is Sadhan Kumar Ghosh from India. Thank you. Yeah, Prema Kumar is there.
Yes, Dr. Prema Kumar. Dr. Prema Kumar, please introduce yourself.
Good afternoon. So,
okay.
Dr. Kumara from IJSCCET. Nice to meet you all.
Okay. So, thank you very much, everyone, for joining us today. Now, I would like to introduce Professor Sadhan Kumar Ghosh to deliver his speech. So, Professor Sadhan Kumar Ghosh is an internationally well-known person in the field of waste management, environment protection, and green manufacturing. He is a professor in mechanical engineering at the founding chief coordinator of the Center for Sustainable Development and Resource Efficiency Management, Jadavpur University of India and Larsen and Turbo Limited. He is also a renowned personality in the field of circular economy, green manufacturing, supply chain management, sustainable development, plastic waste and e-waste management and recycling, ISO and TMO standards. Professor Ghosh is currently the president of International Society of Waste Management, Air and Water, and also serves as the chairperson of Consortium of Researchers in International Collaboration, CRIC. He received several awards in India and abroad and owns patents. He has written more than 200 national and international publications and book chapters. He has been instrumental to the ICONS SWM movement worldwide and has been involved in collaborative research activities with researchers from more than 400 countries for the last 2 decades. Professor Ghosh, can you kindly unmute your mic and share the PowerPoint presentation so that we all can proceed with the technical session?
Very good morning, afternoon, and evening. The August gathering, my friends and partners from different countries and representatives, participants. It's my pleasure that nearly 430 participants from 24 countries are witnessing the webinar. And our purpose of this webinar to make more people in the webinar is to get feedback from different participants from different countries, because you know that waste management in COVID-19 post scenario is really challenging for each of the persons in the world, starting from the person or starting from the child who took part today and the person who is ailing. So in that way, this is very important issue which needs to be addressed for each and every person in the globe. So that's why we made this webinar, so that more people can take part in this. I must congratulate and thank my partners, the SASEP and IJSCCET for their support in making this program happen. You know that my presentation will be divided into 4: the present situation, issues and challenge, priorities and countermeasures, and future need. You know that this COVID-19, this is a scenario which in my lifetime, it never happened. And it is a global tragedy and the tragedy of the centuries. Hundreds and thousands of people died, healthcare system are buckling, economic situation becomes very poor, industries are paralyzed, and uncertainty for millions of people whose livelihoods are collapsing or at stake. This is absolutely the right focus today to save life here and there. In the same spirit of doing what we can do safeguard people's well-being, we must not content ourselves with containing the acute crisis. we must also look ahead to what we can learn from this crisis to prevent the future risks. COVID-19 has given a big jerk to the globe. In many of the parts, we were very happy that we are sending people to the Mars, to the moon. We are sending our vehicles to the Mars and many other things. But you know that modern technology in the advanced society is still at its vulnerable stage. So we must take an oath today to identify and destroy the source that is responsible for this pandemic disaster for the world, whole world. It is not leaving anybody in the world. So that is the tragedy of this situation. You know that if we look into what is happening in the South Asian countries, we have 8 countries in South Asia group. As a matter of fact, that belongs 1/4, 25% of the world's population is here, nearly 1.94 billion. And with respect to the financial condition, this is a region of poor. Extremely poor people and densely populated people are staying here. And the more important thing which needs South Asian countries to take action immediately and very vulnerable is that the geographical location of this region is very close to China, the originator of this COVID-19 virus. So there are the total confirmed case throughout the world now crossed 10 million, which is really a matter of very regret. And here there are number of dates. I mean, I have put the date number a few days back, but now it crossed to 20,000. 8.5% of the global infections are here in South Asian countries, and the 4.1% of the world fatality. The main concern of this virus is transmission. So we must be very careful about how the transmission takes place. And as a matter of fact, if we have loosened in any of the transmission possibility, then ultimately the virus is transferred. Either these are some of the photographs I have just shown you. That sneezing, then infected droplets on your hand, and then COVID is another issue. Like you cannot, whenever you are making countries on the building, you cannot even, you are not daring to touch even your door, not even touching the lift, and many other things. So you are not in a position to shake your hands, and that's why Indian Namaskar is now very much popular throughout the world. Take your hands together, and with a distance you just say Namaskar. But these are the ways the virus is being transferred to the people. And similar way, if the virus is transferred today, of course it is good that the recovery rate is becoming higher, but still you are always at risk if the virus is transferred. Then what are the safe practices? There are a number of safe practices, but most importantly, you have to keep clean your hands and protect your respiratory system. Like we have number of systems for hand hygiene. You wash your hands. So in that way, so you did not hear me from the very beginning. Could you hear me from the beginning?
Yes, sir. Yes, sir.
All right. So in that way, the hand hygiene is one part, respiratory hygiene is another part, and of course, the social distance. You cannot meet your parents, you cannot meet your friends without having a distance of 1 meter or more. This is really very much painful to each of the person. And the other part is the high-risk group. I mean, the people beyond 65 years of age, they are full contained at house for last couple of 5 months. It is impossible for a person. The kids, the situation is such that the education system has totally been collapsed. The industry, the financial system has totally been collapsed. So this is really a unique system which evolved from this COVID-19. So in that way, we will cover three types of waste which are created from the COVID-19. And if we just have a look to the situation, how the waste is generated, it is a ADB data. You know that some of the countries in Asia Pacific,
Hello.
so it is
Hello.
said that, who is
I
there?
can't hear you. Fayaz from Pakistan, I can't hear you.
You have a problem in your microphone. You just take care of that. So the total possible production over 60 days are this. So as a matter of fact, only these 5 countries, they have a total generation of 60,960 tons over last 60 days. So you just think of the situation, how much is the waste generated. On the other hand, you know, zoonotic aspect is one of the very important thing with respect to the evolving coronavirus. So nearly 70% of all the emerging infectious disease cause are zoonotic, and the transmission between the animal and people. So in that way, we have to be very much careful about the prevention of future outbreak, and we must address the threats to ecosystem, wildlife, including habitat loss, illegal trade, pollution, and climate change. If we look into the human life, the pandemic will affect the families, friends, and people around the world. How it can impact, how it is impacting the world's biodiversity and our ability to protect it. The rapid spread of novel coronavirus across the world has led to a steep drop in economic activity, and millions of people are without their daily income, daily wages, and it is really a unique situation worldwide. And it's not only in one country, in the developed country, in developing country, in underdeveloped country, everywhere. And of course, the public health and safety is at stake, and the global efforts to contain the virus through a succession of lockdown across the countries. If you consider India, so in India, we have been under the lockdown period in different stages for the last 3 months. We started from 25th of March. It is a disaster for the economic condition. It is disaster for each of the person in the country. And I'm quite sure that in most of the countries, this is happening. What are the pandemics and the West generated? Huge, a significant increase in waste generation. It has been observed that 30 to 60% more biomedical waste in major cities where the pandemic outbreak is more. Plastic waste has enormously increased due to maximum of plastic in medical, packaging, light equipment, and all these things. What are the specific waste? It has a very specific waste, like the gown made of LDPE, low density polyethylene, mask plastics or non-woven fabric, and face shield of polypropylene, disposable bags made of LDP and HDP, high density and low density polyethylene, saline and bottles and blood containers, which are of PP, special shoes of the workmen involved in COVID-19 treatment and other activities, and the vinyl gloves made of PVC, tubes, all these things are there. So these evolve a big amount of plastic waste in the society. Apart from that, the food delivery packaging material and huge other material used by the COVID facilities, garments, bed, etc. And of course, the wet waste from the hospital and facilities. If we look into again the data, the Thailand's Pollution Control Department recently reported that the amount of plastic waste, especially plastic packaging, increased by 15% from 5,500 tons per day to 6,300 tons per day. And this is mainly because of the demand for food delivery tripled and other things. In Singapore, again, an extra of 1,334 tons of plastic waste equivalent to the weight of 92 double-decker buses was generated. These are all, I mean, you know that data generation is also at stake. In many of the countries, we don't have much data on the waste generation, but the waste is being generated at a very high rate. What are the challenges? Anywhere from hospital, healthcare facilities, and all this sanitizing plastic bottles, even protective equipment that could infect anything out of the virus. Large increase in amount of single-use plastics. You know that in India we took an oath that by 2020 we will make the zero of single-use plastic production and use. But we are now at the dilemma that whether it is possible or not, because the amount of single-use plastic is becoming higher and higher. Of course, the public health is always at risk, and other waste can reach water sources. And as Dr. Abbas Basir was concerning that the riverine and the marine pollution, that is also one of the issues. What are the major challenges? Use of both disposable and reusable masks and gloves will be a component in the solid waste mainstream. You know that there are many large single-use PPE which sometimes thought of by the people by ignorance or by knowledge, that let it be considered as a household waste and put it in the solid waste stream. So the infection starts at this level. And uncontrolled dumping, open burning, these are all again leading to the infected, or leading to the toxic gas, potential secondary transmission to human. The regulatory challenges, and of course lack of legal basis for taking any urgent action measures and institutions. You know that urgent action and legal aspects is very difficult in many of the countries where the number of oppositions are more. Then it is really a problem for the governance. And of course, the other part which has to be very much carefully taken is emotional and scientific aspect while handling COVID waste. Because you know that the dead body, disposal of the dead body, cremation of the dead body, that is also a issue in many of the countries who died after having affected by COVID positive. So this is one of my models. You know that the first and foremost thing is to segregate the COVID waste. That is the mantra and the main thing of waste management. So in that way, the symptomatic and asymptomatic segregated gloves and masks at household level, and here the COVID waste generator at the COVID facility, COVID hospital, all this. Segregation and stored, that is the maximum and the best part of it. If this is done well, then the problem is less. Then the infectious portion, non-infectious portion. If the infectious portion is segregated, go to the biomedical waste facility and incinerate them in controlled environment. And the household municipal waste stream, but there should be a special municipal waste stream for the segregated gloves and masks. In my opinion, this one. And even if it is a non-infectious, that should go to co-processing in the cement plant or WTE plant. So there should not be any recycling of the COVID waste, which is advisable. And main concern is again segregation. This is a usual biomedical waste management, and where we get the incineration product is around 30%, and rest of the part is the 70% for recyclables. And you know that this is also, we have to prioritize that how the circulation of the waste can be made possible, like whether it's taking the private sector, public sector, and communities together to make a circular economy aspects look into. And you know that COVID-19 affects all the 17 SDGs. Now, what are the countermeasures? Legislative guidelines to handle COVID-19 waste have been developed and implemented by only a few countries, but yet to be developed in many other countries. Of course, India has some legislative notification and others. My friend who will inform us in the session. Government support and monitoring. Government must have a control and monitoring mechanism to contain the citizens and protect them. Government has a big role in the containment during the COVID-19 era. Facility enhancement. Enhance the facility of treating COVID-19. We have seen in many countries, even the developed countries, the COVID affected people are not being treated properly because of the facility not there. So you know that I like to inform that India has installed a facility very recently in last month, June 2020, which is having 10,000 beds under one roof, containing a land size equivalent to 29 football ground at Delhi. So, but more number of facilities have been also installed in many other places. And not only in India, there are several manufacturing masks, gloves, gowns, and ventilators. Ventilator is such a thing we don't manufacture to a greater number. So in that way, this is also one of the issues. Healthcare staff should be strengthened. We have observed that many of the healthcare staff, they have become COVID positive while they are treating others. So in that way, that is also one of the issues government should take care. Financial support, huge financial support to the poor and the industries, protect health and environment, and very direct relationship. There must be some countermeasure, but main goals are goal 13, goal 15, goal 14, and goal 12. And of course, India government has made countermeasure points. I'm not going into the detail of this. So these are really a very important issue for general awareness and also implementation. And what are the actions needed? Awareness, commitment, and containment. Legislative framework, mainly the biomedical waste management and solid waste management. It is not only to be treated only for the biomedical waste management. There are huge amounts which are coming in the solid waste management stream, municipal waste management stream. So that should be taken care of very carefully with the policy. Segregation, storing, and disposal strategies. Government support and effective monitoring mechanism and restructuring wherever possible. Safe and sustainable development. Effective guideline for preventing potential damage and its implementation. There are a number of guidelines in many countries. We will also present one guideline which is prepared by IJCCET today. Ensure no recycling. This is my opinion. Ensure no recycling of COVID waste to avoid any type of transmission and infection. That is very important issue. I mean, we should not be go for business only for recycling. And of course, policy for economic activities to continue and grow. These are some of the actions forward, which in my opinion are very much relevant to all countries, including the South Asian countries, because South Asian countries, the economic condition and other conditions, infrastructure condition is not very good. So in that way, we must take action immediately. We should prevent the affected COVID-19 positive cases soon. So with this, I must thank once again to all the participants for their patient hearing and participation in this webinar. Thank you very much.
Thank you, Professor Ghosh, for your very informative speech. Kindly mute your mic and unshare now. Yes, thank you. Now I invite Mr. Kazunobu Onagawa to deliver his speech. Before that, let me introduce Mr. Onagawa to you. Mr. Kazunobu Onagawa is a senior fellow of Institute for Global Environmental Strategies, which is known as IGS. He is currently serving as the director to IGS Center, collaborating with UNEP on Environmental Technologies, CCET, since 2015. He was involved in the discussions of resource efficiency at the UNEP International Resource Panel, G7 resource efficiency meetings, as well as G20 resource efficiency dialogues under the request of Ministry of Environment, Japan. He graduated from Kyoto University in environmental engineering and worked in the Environmental Agency of Japan, which is currently known as the Ministry of Environment of Japan. He worked for United Nations Environment Programme, International Institute for Applied System and Analysis, Austria, Regional Environmental Center for Central and Eastern Europe, Hungary, National Institute for Environmental Studies in Japan, And also, he worked as the director of United Nations Center for Regional Development, UNCRD, where he initiated 2 regional intergovernmental platforms, namely Asia and the Pacific TRIA Regional Forum and Asia and Pacific Environmentally Sustainable Transport Forum, which involved nearly 40 governments from and various UN bodies and many international funding agencies. In 2019, he was awarded with the ICON SWM-CE Lifetime Achievement Award 2019 for his significant contribution in waste management. Mr. Onagawa, the floor is yours. So kindly unmute your microphone and proceed.
Thank you. Thank you very much for the invitation for me to this webinar on COVID-19 and waste management. The waste management is one of the quite common subjects when we discuss COVID-19. As we can easily understand, infectious waste coming from the hospitals, clinics, quarantine facilities are direct sources of epidemic diseases, including COVID-19. No. Sorry. However, we are not prepared well for this problem in our society. It is the same whether it is a developing country or developed ones, in particular under the pandemic condition. We remember hospitals in New York, Italy, Spain were also under such crisis this time. It is reported that hospitals in Latin America, such as Brazil, is having similar problems now. Also, the quantity of medical waste would be increased when infectious diseases happens in pandemic. As Professor Ghosh introduced, ADB estimated that it would be increased by 212 tons per day in Jakarta and 210 tons in Bangkok. It is equivalent to the waste generated by a city with population of about 300,000. The situation is similar as if we are having a completely new city with the population suddenly, and we need to consider its waste management in a panic. I am from the IJOS Center collaborating with UNEP on environmental technologies, in short, named CCET, where we are working on waste management especially. In response to the COVID-19, we have conducted a research on the preparedness for infectious waste management in the world, with a focus on the condition of developing countries and emerging economies. As you know, many guidelines, regulations, instructions are issued already by United Nations organizations, international organizations, governments, and academic associations. We have analyzed 17 international guidelines issued by WHO, UNEP, UN Habitat, US CDC, ISWA, ADB, and others. Also, 29 national regulations and strategies for Asia, Africa, and Latin America. Also, we have prepared a detailed questionnaire and received responses from 14 countries to that developed the questionnaire. What we would learn from our surveys were, unfortunately, many of those guidelines either theoretical or general in nature in terms of COVID-19 and not so much relevant to the conditions of developing countries. This is because those guidelines are prepared not only for developing countries, but also for developed countries as well. Also, those guidelines are prepared for normal social conditions, but not under the pandemic situation. That is why I say currently available guidelines are not exactly relevant to the urgent situation of developing countries under the urgent condition need to respond to COVID-19. Then the question comes, how we can, how we can take a realistic approach while respecting the principles of those guidelines. Guidelines show the correct theoretical directions, and we have no objection to follow these directions. The question we have now is, what would be the realistic approach under the limited capacity of developing countries or emerging economies in terms of facilities, personnel, and financial conditions? As an answer for this question, we are curious about the operation of neighboring countries or the countries whose economies are in similar condition. We have a participation of many South Asian countries in today's webinar. There is a good reason to cooperate or learn each other among these sub-regional countries. Usual waste management starts from separation and collection at source, and followed by transportation to the treatment facilities, intermediate treatment, and final disposal. Separated management of the infectious waste from others is the first principle. In case of infectious waste, incineration is the most widely recommended technology for the treatment in all the guidelines issued by various authorities, including United Nations orientations. Also, they suggest to pay an attention to the waste workers to protect their health by applying PPE, the personal protective equipments. However, the question is again, what we can do if we have no capacity to do so. While this report has made analysis on all of these points, let me discuss today the question on the treatment by incineration. Not all the hospitals are equipped with incineration facilities. In rural area, it is less popular comparing with the condition in capitals and big cities. What kind of technologies and methods other countries and cities use? That is the information we are looking for. This is a compilation of the answers we received from 14 countries in Asia, Africa, and Latin America. This is not the result of analysis of guidelines or strategies which are of theoretical nature, but these are the results of the analysis of real actions being taken by our countries. This figure unveils interesting information which happens on the ground. Yes, including on-site small facilities, incineration is accepted popularly in many countries, but it shows dedicated landfill or chemical disinfection as alternative ways of treatment. Also, it shows cement kilns as an option in lieu of waste incineration facility. It includes burning in open container or place. Naturally, open burning has a risk of infections while workers are handling those wastes. However, we can learn the real and practical ideas of infectious waste treatment from this information. It is important to follow the principles of waste management suggested by international guidelines and strategies. This figure shows more theoretical flow of medical waste management summarized from international guidelines, but with some consideration of the limited capacity of developing countries. It is important to pay attention to such principles as possible as we can, even if we are under. Yeah,
It is not coming.
Yeah, then the next step is how to be prepared for the development of Build Back Better scenarios, not only to respond with quick actions for COVID-19. Once situation comes better, it is a time to consider such a long-term strategy for municipalities and countries in the region. In that work, we have to take into various components into the consideration listed in this table. We are planning to publish this report within this month. Hello. Yeah. We are planning to publish this report with.
Thank you very much.
Thank you, Mr. Onagawa, for your very informative and detailed speech, and also for presenting the guidelines on COVID-19 waste management. May I kindly request you to mute your mic and unshare the screen? Okay, thank you very much. Now, may I invite Dr. Abbas Bazir, Director General, South Asia Cooperative Environment Program, to moderate the next session. Dr. Bazir, kindly unmute yourself and take forward the proceedings. Thank you very much.
Thank you, Professor Ghosh and Mr. Onagawa, for your informative presentations. Now, all of participants are welcome to the next session. The session will present and discuss the statements by representatives of some member countries on country situations and actions on waste management and post-COVID-19 era, and comments on the guidelines and a presentation on waste management goals for South Asian countries and its progress and implementation. All participants may know that SAQIP is an intergovernmental organization established in 1982 by the government of South Asian countries, namely Afghanistan, Bangladesh, Bhutan, India, Maldives, Nepal, Pakistan, and Sri Lanka. All of these countries are active members of SAQIP. Today, this is an opportunity to hear from member countries about the status of COVID-19 waste-related issues in these countries. So I would like to request all the speakers, one after another, to unmute share the screen, and after presentation, unmute and unshare. Every speaker has only 10 minutes to deliver his or her presentation. First of all, considering the time limit, I would like to invite Dr. Kumara, Deputy Director of CCET, to deliver his presentation. Dr. Kumara, floor is yours. Dr. Kumara will be having a general overview of waste management in South Asian countries and progress which is made in these countries. We have already, as I mentioned in my opening remarks, we have developed a roadmap for sustainable waste management and resource exploration in South Asia in collaboration with IGS. Dr. Kumara will have an introduction to that roadmap. Dr. Kumara, floor is yours.
Thank you, Dr. Basir. So good morning and good afternoon again for everyone. Yes, Dr. Basir, thank you for kind introduction. So I'm Kumara, Senior Researcher, Deputy Director with IGS CCT in Japan. So actually, I was supposed to make a brief presentation about the roadmap for sustainable waste management and resource circulation in South Asia. Actually, this is a joint work that SACEP, IGS CCT, and UNEP ITC together all the governments in South Asia to together develop this roadmap. So it was actually has two main targets. One is roadmap itself, and another one is a study of existing waste management in the region. So as I mentioned, so we got the continuous support and participation of the all 8 governments in South Asia through SACEP, and also the expert and international community also for this exercise. So last 2 years, starting from 2018, so we had developed these two outputs, two products in this exercise. So I'm so happy that the roadmap itself in the last SACEP Governing Council in Bangladesh was approved and adapted. So now we are publishing both the status report and the roadmap. I hope fully we can publish that within next couple of months. So why actually I feel South Asia is a matter, because I feel like two things. One is South Asia is very dynamic in both the urbanization. Of course, one of the main subject that the main issue all South Asian governments are going to face and also facing. So what we found in our quick study in South Asia, so we found that there is no common understanding, and also like Professor Ghosh mentioned, so accurate data on waste management. This is one of the main issues we found in our work in South Asia. We also found all our governments have definitions like waste in their national rules and regulations, but they are very different. But at the same time, they are very discussed based in more waste perspectives rather than the resource perspectives. And also we found that the data is limited, but at the same time, the waste generation is increasing, like Professor Ghosh mentioned. So we try to identify the existing data. You can see this table, especially in the column A, is the one that we found from the government's data, but we cannot comparatively look at data because they are in different definitions and also the different calculations. So in that case, in the column B, C, and D, we try to estimate the waste generation in South Asian countries based on the World Bank 2080 report. So it's look like something different. What's the figures showing at the moment in the South Asian countries data, but at the same time the estimation done by the World Bank data. And based on World Bank data, there is some similarity, but they look at the waste calculation. So it's easy for us to look at comparatively each country. So in that case, we use the World Bank data in that comparative discussions. At the same time, so we found that, of course, in South Asian situation, most of the waste is organic. So more than average, 56% of our countries have organic waste. This is something different from when we look at the developed countries in other regions. So that's make us sense that the South Asia had to look at their own technologies and their own systems to manage the waste in their countries. At the same time, we found that the still waste management service is very poor, very weak in South Asian context, and collection rate in South Asia in average is something 44%. But we found it's very quite increase in the waste collection, especially in countries like India. In the last 3-4 years, they achieved 80%. But in average in South Asia context, it's still 44%. And the most common practice is open dumping and the open burning is used by many countries. But at the same time, we found very good cases that the composting and biogas practice at the both decentralized, centralized level in all countries, but they are very limited scale, but have high potential to scale up and national-wide program now taking like India and Sri Lanka and Bangladesh. And also when it comes to biogas, we saw very good programs going on Nepal and Bhutan also in that context. And in the new technology like waste to energy, both incinerator and RPF are experimenting in India and also some other countries like Pakistan and also Maldives is also getting interest in introducing waste to energy in their context. But still these are in the experimental stage. So need to learn more on this success in these technologies in their own situations to the other cities. And I also added this is most difficult part because we found that the today discussion mostly on COVID-19 and the medical waste, but we found that it's very rare in the this kind of a waste because most countries have somehow municipal waste information, but when it's come to the emergency waste like medical waste, electronic waste, construction, development, demolition waste, this kind of a waste is very limited information available in the countries. But we found our review in many literature with the expert and some data were there. And also in the medical waste, we found very interesting in South Asia. Most of the countries have a very good regulations and the policies how to manage medical waste, except we couldn't find Pakistan. But many other countries, there were very good regulations. But the issue is implementation. So when it's come to the implementation, every countries have issues in handling the medical waste. That's what I think the Mr. Onagawa's presentation mentions, that the technology issues in and capacities of the medical waste. And also electronic waste we found is increasing very fastly in this in South Asia in the last like 2014 2016. It's doubled in many countries in the electronic waste generation. So but at the same time we found for the electronic waste most countries doesn't have proper regulations and policies to handle, except India. They have 2011 and 2016 regulations on the electronic waste. But some countries handle electronic waste under the hazardous waste regulations, but not specifically regulations available for the electronic waste. When it's come to the plastic waste, also we found it is one of the main issues in the South Asia. So we try to develop some kind of scenarios how the plastic waste generation based on the World Bank 2080 data. And it's looked like all the countries are increasing fastly of the plastic waste from 2016 to 2015 if we not take any attention to handle these issues. So based on this information, what we learn in the discussion with the countries in this developing this action plan, so it's immediately needs some kind of changes in way that waste management was handling to how to move it to the more resource circulation perspectives. So that is one thing that the whole roadmap came to see, and roadmap tried to develop the scenario how South Asia can be moved forward in this direction. So for that, at the same time, when the discussion with the governments and the SACEP and it's looked like there were a lot of global and also regional commitments to improve the waste management in South Asia. So you can see in the green column is regional declarations, like a Dhaka Declaration in 2004, SARC plan on 2088. All these identified the importance of waste management and sustainable resource efficiency in South Asia. So we came all these, we review all these commitments and try to integrate these things into the roadmap and make it more comprehensive. And then I would like to slightly share with you.
2 minutes. You have 2 minutes to conclude.
Perfect. So let me share my roadmap. So that the roadmap is include 4 overarching objectives and 12 strategic principles. So actually, it's include 15 strategic targets in the country. I want to show this slide because some of targets are very directly related with today's discussions, especially target 11 and the 14. Both are addressing medical waste management at both medical facilities. At the same time, medical waste coming from the domestic waste. These two should be addressed. But at the same time, like a waste separation, like Professor Ghosh mentioned, plastic waste increase and the data, these are also in line with today's discussion. I feel the rest of the discussions, they will discuss these issues and see how these activities are happening. And here identify like a plastic waste. It's a three targets identify plastic waste: single-use plastic, plastic recycling, and the marine plastic. I think Dr. Bashir mentioned, so SACEP already started working with the World Bank in addressing these 3 target areas. So I feel that this roadmap, the targets are very much practical in that sense. So it's also identified 38 actions areas related to waste management, sustainable production, consumption, and the data management. So it's also identified the interrelations, connection with the local governments, national governments, and the regional institute like SACEP, SARC, and other international agencies, how to implement this roadmap for 2030. So I think I will stop here. So I would like to join any discussion in the later. Thank you very much.
Thank you, Dr. Kumara, for your general overview of waste management in South Asia region. Now we are going to discuss a specific country situation in terms of waste management. So we start from Afghanistan. I would like to invite Mr. Saeed Qayyum Hashimi, expert in monitoring and inspecting of clinical solid waste, National Environmental Protection Agency of Afghanistan. Mr. Qayyumi, Mr. Hashimi, floor is yours. Please consider the time.
Okay, good day, everyone. Thank you for having me in this event.
Kindly make it
I
full
hope it's
screen.
audible now. Okay. Despite implementing social distancing and due to having limited facilities for testing and samples, COVID-19 outbreak and spread looks to be pretty fast in Afghanistan. So we have a a big number of infected people with COVID-19 in Afghanistan. As of today, the numbers that you can see on slide could be changed because this number is from 2 days ago. But we can say that over 30,000 people are confirmed to be affected, and about 800 people dead from COVID-19 in Afghanistan. About 45 private and governmental hospitals are involved with testing, isolation, and quarantine of infected people, as well as some governmental places, hospitals, and schools are dedicated for isolating infected people in Afghanistan. The framework that explains the medical waste management in Afghanistan includes some legislative documents, as well as a committee, a medical waste management committee that have a frequent meeting and monitors the procedure for medical waste management in Afghanistan. As you can see on the slide, the two images of this committee shows meetings and site visiting of this group managing waste, medical waste after the crisis, because as you know, currently we have different issues in managing medical waste due to insecure situation and some lack of facilities that we are facing here in Afghanistan. So we have the plan for making a procedure for post-pandemic management for medical waste. Also, in addition to National Environmental Protection Agency, also Ministry of Public Health has some legislative documents clearing the procedure for medical waste management in Afghanistan that you can see on slide. That these legislative documents are prepared previously or currently they are working on these legislative documents in cooperation with NEPA and also municipalities. We are working to finalize these documents and make a vast and inclusive framework for managing the solid medical waste overall the country. The mechanism for medical waste management is, as you can see on this slide, we have a joint team from Ministry of Public Health and also NEPA, National Environmental Protection Agency. We have a frequent monitoring task, and we give guidances to healthcare centers. They manage how they can manage the medical waste, how is the generation of this waste, how they can segregate it, and how they can send it for disposal, or which kind of this medical waste can be recyclable. And also how they can collect it, and we are enforcing them to have an IP program, infection prevention program, each healthcare center, and the method and procedure of collecting and transporting of this medical waste for disposing. The responsible organization for disposing medical waste currently are some governmental hospitals, including some private sectors, which they have incinerators. Then infected medical waste are being incinerated, and some uninfected medical waste, as you saw previously in this slide, like some plastic and glasses, they can be disinfected and sent for recycling. But as Professor Ghosh mentioned in his presentation, we should ensure that infected medical waste with coronavirus shouldn't be recycled. This is our consider, and we are trying to find the exact number of this medical waste that can be recycled, but we should prevent due to the infectious state. And also we are conducting some public awareness programs in collaboration with Kabul municipality and Ministry of Public Health. We're conducting awareness program on market and on the street, also from different medias. And as you can see on this screen, we pay by pasting some informative pages on the streets. We are informing people from the dangers of this infected waste and giving them some information how they can handle this waste if they have some patients or some infected family members, and if they're working in markets and if they are involved with this situation, how they can handle this infected waste. We are giving awareness for the market, like bakeries, shopkeepers, or other ordinary people on the street. Also, here are some general rules for managing the medical waste that are implemented in Afghanistan. The important points in these rules are the incineration of infected waste like body parts or other infected clothes or strange or some other parts that cannot or dangerous, and also burying some parts of this medical waste, some organic part of medical waste that are not too dangerous, according to the healthcare laws from Ministry of Public Health that I mentioned before, or laws or regulations from Environmental Protection Agency. Also, which kind of this waste can be recycled. These are almost 10 different guidances that we are sharing with healthcare centers, with private sectors that are managing this waste. We are sharing these rules and we are asking them to consider these rules and in managing waste or handling infected materials. Finally, remarks of this presentation. Altogether, we can say that over 30,000 people are infected. This infected number is increasing day by day. Some private hospitals and governmental hospitals are involved in testing, isolating, and quarantine of this infected people. So we are trying to get updated numbers of patients because it can have a close relationship with the amount of infected waste that are produced in these centers. Also, we are trying to improve legislative documents and make documents that can have more focus on COVID-19 medical waste management. And also, we are trying, or we have planned to make a post-pandemic plan to evaluate the situation that we are faced and we have been faced previously, or for any future cases if the bad scenario of COVID-19 that is probable shows. So we are trying to be able to manage this situation if it will happen in the future. Thank you so much. That was a very brief report from Afghanistan. Hope it was clear and I could manage it within the time that I was given. Thank you so much.
Thank you, Mr. Hashimi, for your informative presentation. I'm very happy to hear that already a specific mechanism for medical waste management is established in Afghanistan, and awareness program is also running. A guideline also is already available in this country for medical waste management, but of course, still medical waste collection from inside hospitals or outside hospitals, particularly outside the hospitals, would be a challenge for Afghanistan.
Exactly. Thank you so much.
Now we will be moving to Bangladesh. I would like to invite Mr. Parimal Singh, Joint Secretary, Minister of Environment, Forest and Climate Change of Bangladesh, to deliver his presentations. Mr. Parimal Singh, the floor is yours.
Thank you, Honorable DG Sakeb. Can you hear me?
Yes, please go ahead.
Thank you.
Please share.
Today's meeting, very vital meeting. Sure.
Do you have presentation? Do you have PPT? Share your presentation.
Sure. Just a minute.
Dr. Basir,
yes.
May I comment? Yeah, I request all the speakers to please open your PPT in your laptop in advance, so that whenever you are requested, you can easily do that. Otherwise, it will take time. That will be helpful for you. So please open your PPT if it is there in the laptop. Whenever you are requested to share, you can share it immediately. Thank you.
Yeah, if you keep it open in your laptop, so it will be much helpful.
Yeah.
Actually, the PowerPoint presentation is not opening. Is it?
What is the problem?
The PowerPoint presentation is not opening. Okay.
Okay. So
it's okay. See. Can you see the PowerPoint presentation?
No, not. It is not visible. So go to a screen share. There is. Can anyone guide Professor Bush? Can you please guide?
Mr. I can see. Yeah. I can see Mr. Hakim, who is trying, who was in the trial run yesterday night. But what Dr. Basir, I suggest.
Mr. Hakim is with me. He's trying.
Okay. All right.
Okay.
So what I suggest, Dr. Basir, let him try with that. Meantime, you can switch over to the next speaker. Meantime, if he can manage it, then it will be he will be the next to next speaker. Then we can save our time.
I think this is good proposal. If Mr. Parimal Singh is not ready, we can move to other country.
Okay.
Yeah.
So now I would like to invite Mr. Narayan Singh, Chief Environment Officer, Ministry of Environment and Climate Change, Government of India. Mr. Singh, the floor is yours. you can start your presentation.
Oh, great.
Yeah,
Thank
we
you.
see your presentation. Yeah.
Thank you for inviting me in the webinar. As we know that biomedical waste generated during diagnosis, treatment, immunization of human and animals, and this biomedical waste contain infectious human, anatomical waste, soft waste, pharmaceutical waste, etc., which are harmful. And improper biomedical waste management may create risk to healthcare worker, waste handlers, and general public. In India, legal framework exists for ensuring safe management of biomedical waste. Biomedical Waste Management Rule 2016 have been notified with the objective to improve the segregation, collection, processing, treatment, and disposal of biomedical waste in an environmentally sound manner. Some of the salient features of these rules are: this rule defines duties, responsibilities of occupier of healthcare facility, operator of common biomedical waste treatment facilities. Emphasize on segregation of waste into 4 different color-coded bags. It provides training to all healthcare facility workers and other waste handlers for handling of waste and to protect themselves against diseases such as hepatitis and tetanus, etc. of all healthcare workers and waste handlers by providing appropriate and adequate PPE. And this also provide that healthcare facility to conduct health checkup at the time of induction and at least once in year for its healthcare and other involved in waste handling. Know that HCF generates general waste around 80% and biomedical waste around 20%. If it not segregated, then infectious waste quantity will increase significantly, and which would increase the cost of treatment. To avoid this, to make the treatment efficient, etc., are falls under this category, and this waste are pre-treated through autoclaving, microwaving, followed by shredding, and treated waste to be sent to registered recycler or energy recovery. White bags collect needle of syringes, blades, and are collected in the puncture-proof, tampered-proof container. And in blue bag, glassware broken or discarded and contaminated glass, and it is disinfected and sent to the recycler. These waste are collected and transported to the common biomedical waste treatment facility where treatment takes place and disposed of in an environmentally sound manner. If a healthcare facility are not connected with the common biomedical waste treatment facility, then they have to treat at site. To ensure occupational safety of all healthcare workers, they have to use PPE such as masks, goggles, apron, face shields, gun boots, and they should maintain the hygiene by washing hand. It is shown in this slides. Periodic health checkup is required at the time of induction and at least once in the year for its health care and other involved in the waste handling practices. These are the data about the biomedical waste generated in India. Average infectious waste generation from hospital are 0.3 to 0.5 kg per bed per day, and bedded healthcare facilities is around 87,000, and non-bedded healthcare facilities are around 1,51,000. Total generation of biomedical waste is around 559 ton per day, and the quantity of waste is being treated around 516 ton per day, which is around 93% of the total waste generation. For treatment and disposal, there are around 198 operational common biomedical waste treatment facilities, and 24 are under construction. And there are around 9,841 captive biomedical treatment facilities. During an outbreak, COVID outbreak, many types of additional medical and hazardous waste are generated, including infected masks, gloves, and other protective equipments, together with higher volume of non-infectious items of the same nature. Unsound management of waste could cause unforeseen knock-on effects on human health and environment. The safe handling and final disposal of the waste is therefore a vital element in an effective emergency response. Therefore, CPCB, Central Pollution Control Board, has issued comprehensive guidelines for handling, treatment, and disposal of COVID-19 waste. These guidelines have been developed in consultation with the experts from Health Ministry, Urban Development Ministry, Environment Management, people, doctors, operator of common biomedical waste treatment facility. These guidelines are revised regularly based on the experience of the implementation. COVID pandemic has changed the source of generation of biomedical waste. It is not only specific to the healthcare facilities, but it also from the quarantine center and home quarantines are the new source of the biomedical waste generation. The guideline addressed the COVID-19 waste generated at healthcare facility, quarantine camps, quarantine homes, home care, sample collection center, laboratories. Guidelines provide the methods for collection, transportation, and disposal of such waste. Guidelines also emphasize on safety of waste handlers, sanitation worker associated with the healthcare facility, local bodies, and common biomedical waste treatment facilities. Guidelines provide the steps to be taken at COVID-19 isolation ward. These are the steps. Separate bins has to be installed for ensuring proper segregation. This should be foot operated lid/bags container. Double layered bags to be used for collection of waste to ensure strength and no leakage. Collection of bin should be labeled as COVID-19. Keep separately in these waste should be kept separately in temporary storage room prior to handling over. Only authorized person can access this waste. General solid waste should be collected separately and disposed of as per Solid Waste Management Rule 2016. Bin, container, trolley used for a storage of COVID-19 waste to be disinfected with 1% sodium hypochlorite. Maintain separate records of COVID-19 waste. Segregation of the waste is very important for the collection, transportation, and treatment. Therefore, list of items has been identified for the collection in yellow bags, red bag, and as treated as a general waste in order to make people understand about what steps to be taken for the specific waste, such as in red bags, collect used PPE such as goggles, face shield, splash-proof apron, plastic coverall, hazmat suits, natural gloves. For yellow bag, head covers, cap, shoes cover, disposable linen gown, non-plastic, semi-plastic coverall, waste contaminated with the blood, body fluid of COVID-19 patients to be collected in yellow bags. leftover foods, disposable plate, glasses, used masks, used tissues, used toiletries, etc., used by the COVID patients shall be collected in the yellow bags. And items also been identified for the general solid waste, such as wrapper of medicine, syringes, fruit pills of empty juice bottles or tetra packs, empty water bottles, discarded papers, cartoon, etc. Proper training to medical waste handler helps to prevent harm to the worker, patients, and other individuals who may come in contact with the waste. Then they should be aware about how to maintain the hand hygiene, respiratory etiquette, social distancing, also which type of PPEs they should use, how to handle the waste, and it should be demonstrated in the local language. Some instruction has also been given for the common biomedical waste treatment facility, such as use dedicated vehicle for collection of COVID-19 waste, sanitization of vehicles after every trips, provide adequate PPE to workers to ensure regular sanitization of worker engaged in handling and collection of waste. COVID waste should be disposed of immediately upon receipt at facility. Maintain separate record of COVID waste. Training to be provided to the worker for safe handling. Registration and record uploading on web-based tracking apps that has been developed by the Central Pollution Control Board for online monitoring of the waste management. The risk of transmission of virus that causes COVID through sewage system is not very thought of, but however, following the precautionary measures have been suggested for the management of wastewater also. Agencies to ensure proper disinfection of treated wastewater, operator of ETP, STP to follow SOP to maintain basic hygiene, and during the period of COVID-19 pandemic, utilization of treated wastewater in utilities within SCF may be avoided. For public awareness, following steps have been taken. A video on COVID-19 waste management has been developed and uploaded on the website. Pictorial guide on biomedical waste management, including COVID-19 waste, has been developed. And do's and don'ts for quarantine camps, centers, or human cares, or for urban local bodies, so that they should understand the things very easily. Poster has been developed for on-site segregation, collection of waste, handling of COVID-19 biomedical waste at temporary storage site. All these documents have been shared with the State Pollution Control Board and local urban local bodies for use. Thank you.
Thank you, Mr. Singh, for your presentation. I think it was very much helpful for other countries also. It shows that a very detailed guideline is already available in India, which includes segregation, collection, transportation, safety of work handlers for safe handling, and also training of the handlers. So this is very important areas that you already have covered under this guideline, which is very helpful for safe management of COVID-19 related waste. Thank you for this presentation. Now, if Bangladesh is ready, I would like to invite again Mr. Parimal Singh to deliver his presentation. Mr. Karimar, are you ready?
Yeah, ready.
Okay.
The
Please
sharing of is okay. Good. Hello.
We can hear you.
Yeah, I can hear, but the screen sharing is not. Oh, okay. Let's.
All right. Rahul, are you ready, Rahul?
No, give answer. Just
it has been done.
We had your presentation. It was lost again. Yeah, it is here.
Make it bigger.
Okay.
Full screen.
Yeah.
Full screen.
Full screen.
Okay, you can put it in full screen.
Is it full screen?
If it is possible.
Yeah.
I think that's okay.
Is it okay?
It's okay.
Yes, it's okay. Yeah.
Thank you very much.
White is black.
It's okay.
It is black. It's black. It is again missing. I don't know what's the problem. The presentation is not available now.
নমস্কার, COVID-19 আনলকের প্রক্রিয়া এখন সারা দেশে শুরু হয়ে গেছে। এই সময় নিজের বাড়ি বাইরে কখনো বের
So, if there is a technique.
Okay.
Yeah, we have the presentation now.
Yes.
Yeah, it's visible.
Thank you very much. Sorry for disruption. This is Porimor Singh from the Ministry of Environment, Forest and Climate Change. The pandemic is very much frightening situation in Bangladesh. I am highly appreciate today's organizing this webinar to Mr. Honorable DG Sakef for managing and for organizing this meeting. The present presentation. Okay, this is the next slide. Is just a minute. Next slide. Okay. Just a simple slide here. You can see the present status of Bangladesh before COVID situation. You can see there, but actually there is no accurate, reliable data on the amount of medical waste generated, especially in the city corporation area, especially in Dhaka. So we have some data, so we can't see the next slide. We cannot see the next slide. Some technical error happening here. Actually, could not fix it.
It is visible now, but you can go to the slide.
I want to go to the next slide, but it cannot visible here. You cannot.
You use. Please use the drop down button. The down arrow button you can use. Your first slide is visible, so you have to go downward. For that, you need to select the drop down button, the down arrow.
But the is not working. Actually, the presentation is actually I have sent you the presentation, but it cannot showing here due to technical problem. I think
so you can continue. You can continue. I think.
Yeah. The COVID pandemic has already had a tremendous impacts on the West sector, especially in Dhaka metropolitan areas in Bangladesh. As you know, Bangladesh is a very densely populated country. Due to this pandemic, the amount of medical waste is dramatically increasing, and we are vulnerable for medical waste management for COVID-19 due to technical and financial constraints. Therefore, facing a big challenge to reduce the risk for human health environment. And I do hope today's meeting will enhance cooperation and sharing practical knowledge on COVID-19 management. Health services under the Ministry of Health also addresses these issues before issuing their license to clinics and hospitals. So during this pandemic situation, DGACs follows the waste management guidelines related to COVID in hospital. We have city-specific, before COVID-19 situation, we have city-specific data on medical waste, particularly relevant data on Dhaka City Corporation areas. Around 1,500 health facilities are operated. The guidelines set out for medical waste management, I have said before, the management and processing, treatment and disposal. This is a PRISM, the only non-governmental organization which now they are operating their task in full swing. They mainly undertake general practices at their pandemic premises, like separation, autoclaving, incineration, burial pit, chemical disinfection, and final disposal at their designated landfill areas. So apart from Dhaka, under public-private partnership, they are also working their activities in another 4 areas, municipal areas. We have a private organization named SDG. They have researched on waste management from the very first month of pandemic. The amount of hazardous plastic waste is approximately 14,500 tons, and it has in 1 month, from March 27 to April 27, and has emerged from the dramatically increased use of single-use surgical face masks, hand gloves, and sanitizer and polythene bags in communities and healthcare facilities. On the other hand, data from PRISM Bangladesh, which I mentioned earlier, the private organization, they said that approximately 10,000 kilograms a day hazardous medical waste is generated. So this is the condition. But the post-COVID-19 situation, now the hazardous medical waste has been compounded with a huge amount of infectious COVID-19 waste. So considering the whole amount of waste, the COVID-19 waste from household become the major threat to public health and the environment. The government of Bangladesh is making their sincere efforts to address the issue in a coordinated manner, involving all the stakeholders on board, but challenges is huge. Actually, in this situation, concerned regulatory authorities, Department of Environment, Director General of Health Services, city corporations, mainly they are mandated, are regularly monitoring the whole disposal system. In the meantime, the city corporations are drawing up a strategy for the management of this waste. Concerned ministries, especially Ministry of Environment, Forest and Climate Change, Ministry of Health and Education, local government division, join their heads together to find out an effective handling and management system in this situation. So dedicated vehicles, medical autoclaves, and incinerators need to be procured. Initiatives are being underway. In this post-COVID situation, I have already mentioned, apart from the improved in-house management in hospitals and clinics, the government is planning to gradually provide separate plastic bags for COVID-19 waste to each and every household in cities, and the responsible community-based waste collectors at each ward will collect the waste stored in those separate and specific plastic bags. So we need a wide range of training, public awareness, which are going on. Mainly the Director General of Health Services, they are following the World Health Organization guidelines and ADB guidelines in doing their awareness among publics. So the challenge is actually a big from the perspective of Bangladesh side. We're trying, the government is trying, regular basis they are sitting and planning, and we hope it will be overcome very fast. So public awareness is basically needed. Improper disposal of hazardous COVID-19 medical waste can cause massive pollution and environment components, including soil, water, and air. Medical waste is particularly difficult to handle as it is mixed of both wet and dry waste. It is highly contagious. The improper waste disposal can also interfere the food supply as well as the plant growth is impaired, reducing the amount of food produced. So till today, till yesterday, the Bangladesh, we have confirmed COVID cases 150,000. So this is the trend in Bangladesh. So earlier I mentioned that the government is trying hard and soul, and today's meeting actually will be greatly impact in decision-making process on COVID-19 medical waste management, indeed. So this is the our situation in Bangladesh before the COVID situation and post-COVID situation. And we have expertise, especially the regulatory bodies, Department of Environment and Department Director General of Health Services. Constantly they are working with each other with the help of policy making authorities. Regularly they are following the waste management system, and I think it will be a great achievement with the help from your side. Today's webinar, this will greatly impact on our policy making process. So this is the situation post-COVID in Bangladesh. So I have now again, this is a big challenge. We hope we try to explore and by today's webinar and share good ideas and thoughts and experience from your side, from the other side. So I think I have to finish. Thanks everybody for patient hearing. Thank you very much.
Thank you, Mr. Parimal Singh, for this presentation. Actually, you shared very good experience of your country in terms of COVID-19 related waste management. The two important issues was that there is a coordination mechanism between related agencies. It is available. Right. Also, public-private partnership established to handle this waste related to pandemic. There was also a great concern about household waste. So it is good that you are preparing for this issue also to be addressed. But anyway, thank you for your presentation. Now, I would like to invite Mr. Bandari, Senior Public Health Administrator, Department of Health Service, Government of Nepal. Mr. Bandari, the floor is yours. Mr. Bandari, are you available? I don't hear from you. Okay.
No,
okay.
he is there. We can see him.
He is there.
He is there.
Okay, please go ahead. Boss.
शेयरिङ मतलब स्क्रिनमा प्रेजेन्टेसन आउनु पर्यो हजुर प्रेजेन्टेसन गर्नु कहाँबाट खोल्ने भन्नु त्यो अघिको फाइल छ पेन ड्राइभ हेर्नु यो फाइल यो Okay. Hello, good morning, good afternoon, and good evening, everybody from Nepal. Can you hear me?
Yes.
Hello.
Please go ahead. Yes.
Okay. May I continue?
Yeah. Please go ahead.
Yeah. Okay. Okay. So, thank you very much. This is a good opportunity for us to share with all of us, and we have also learned many things from previous presentation. Again, namaste and good afternoon from Nepal. I am Chudamani Bhandari from Ministry of Health and Population, working for Department of Health Services. And in case of healthcare waste management, we are working on environment, health, water and sanitation and hygiene, as well as healthcare waste management in an integrated way. And we have a constitutional mandate as well as for the quality of health services. And Ministry of Health and Population is aware and moving towards the quality of care at the service delivery point of healthcare waste management. And we have, as I have already said, we have a constitutional mandate as well as civil rights. And then I didn't go into detail on the global status, but as we have report improved water as per 2016 from Global GMP Baseline Report 2019, and this is 93% improved water. As we see in basic waste management, there is only 1% at that time. We have different, as I have already said. Can you hear me properly?
Please go ahead.
Yes.
Okay, thank you.
Yes, go ahead.
And then, okay. And then we have healthcare waste management guideline. Previously in 2014, now we have updated, but that is yet to be approved. That will be 2020 healthcare waste management guideline. We have different policies, different acts, which are responsible and guiding principles, and as well as for the healthcare waste management, WAS, and all this including environmental health. Now on COVID pandemic focus healthcare waste management in the context of COVID-19 emergency guideline we have, and then guideline for environmental cleaning that we have. So based upon these guidelines, we have some other standard as well, national standard as well. As I've already said, national standard for operating procedure has been drafted and we have updated. That is yet to be approved from Ministry of Health and Population. We have emergency guideline. Then healthcare guideline, it covers all the COVID-related waste, including PPE, and emergency, some vast provision for the transitional methods, interim solutions, and practices for safely managing healthcare waste management. And it recommend for the minimization, collection, treatment on site, and burial, as well as leave for natural diaphyton, then as well as occupational safety and health. And environmental cleaning and disinfection in context of COVID-19, overall objective to guide the cleaning and disinfection of methods, health facilities, triage area, passage toilets, quarantine, public places, vehicles, and methods we are using infected source with soap and detergent with water, sanitizer, and for detail, we have guidelines, so I don't want to give the detail. So it's just brief about what we have developed during this emergency and that we are using now. And WAS in healthcare facility is also improving, though it was not satisfactory previously, as I have already shown on previous slide, but now it's improving. Where structural adjustment on the federal level, the division, management division where I work, this is the one of the responsible division for the healthcare waste management and WAS. And it's also, there are some technical working group and hospital management committee at the hospital level in federal hospital. And at provincial level, there is Ministry of Social Development. It will handle for the provincial level hospital, healthcare waste management. And at the local level, there are metropolitan, sub-metropolitan, and municipalities. There are technical working group and healthcare waste management at the health facilities and hospitals, including hospitals. And then we have, in 2019, December, we have first national workshop on integrated healthcare waste management and WAS in healthcare facilities. And there are 12-point agreements, mostly focused on the policy framework as well as campaigning healthcare waste management and work on the integrated way and make a collaborative framework and occupational health and safety and information systems with your mandatory waste management and waste audits, including investment in human resource capacity, include climate change, and adherence of 4R principles: refuse, reduce, reuse, and recycle, and mainstreaming environmental health, healthcare waste management, and WAS, and research and innovation. These are some of 12-point agreement from this workshop and which are approved by ministry. And integrated healthcare waste management means there should be legal capacity building as well as monitoring and showcase. It will handle on that case. And initiative for the management in COVID response, safe management of waste from evacuation site. When it was first when the outbreak of novel coronavirus has presented, the Ministry of Population, Health and Population, with an early commitment in made national workshop, healthcare waste management, the rapid and well-coordinated response, which has unfolded, has been a testament to the spirit of openness, partnership with the national workshop, as well as in February 2020, Government of Nepal decided to evacuate 175 Nepalese students from Hubei province in China and to quarantine them upon arrival in Kathmandu. As plans were drawn up, the containment of potential case of COVID-19 within Nepal was a top priority. This state enlightenment UMSB to develop clear protocols, collection, transportation, and treatment. It was an opportunity for us. So, where on the procurement and supply of PPE, interim management of healthcare waste management, regular supply as to the health workers, and and develop guidelines assisting strengthening healthcare waste management at COVID-19 hospital has been upgraded as well as designated for the healthcare waste management during this COVID-19 period. Focusing on COVID, we are providing the services in the healthcare waste management. Sorry for there are number is missing, little bit changed, but the resource allocation for strengthening healthcare waste management and was in remaining 12. We have 25 hospitals, our hospitals, and among them it was covered by, from GIJ, and 12 hospitals have been provided some allocation for the healthcare waste management, as well as other 13 hospitals, and was in healthcare facility was provided, including some public places, and capacity building of healthcare worker and waste handler was done in this period. And there are some key issues and challenges: limited understanding about the health hazard associated with healthcare waste, limited good practices and technology, inadequate coordination among local, provincial, and central government, because we are in the process of restructuring. And currently, we have the federal government as well as provincial and local level government. We are practicing, so there are some confusion as well. So, inadequate cooperation with private sector and community involvement, lack of strategic business, because COVID is new, so everybody are new to plan and implement this. And then enforcement of environmental protection related rules and compliance of healthcare waste management guideline is an issue. And there are direct and indirect implication of extended lockdown, COVID case increasing trend, challenge quality assurance of PPE and other medical equipment, quality tests by home, it's questionable, limitation of reliable supply in the market, and low produce material are in market but not standardized. So these are some issues, some related to the COVID, and unmet emergency needs from local, province, and federal government, because ad hoc planning and urgent demand of many PPE, like these things. And finally, I want to conclude, and way forward will be effective implementation of guidelines that we have developed and implementation of healthcare waste management plan. As we have seen that there are roadmap for the SAARC countries, so we can, in line with that roadmap, including this COVID situation and healthcare waste management, and use of reusable items. Easy example is PPE, because we're using many disposable items, so it will be a huge problem for the healthcare waste management. So we need to use reusable items, and addressing ESR during restructure to ensure quality tracking and monitoring mechanism, reinforce the segregation and transportation facilities, because it is one of the problem that in waste they are mixing in many places. We should reinforce for that, and occupational health safety and health worker staff to PPE and vaccine against SBB and tetanus, because occupational hazard is there are so many cases because of improper use of PPE like this be addressed, and capacity building of health workers, and refurbishment of waste treatment center, installation of autoclave in, as I have already said, in 25 hospitals, and expansion of healthcare waste management in all hospitals. So, including central treatment facilities should be there, there in municipality, because there are very few central treatment facility in Nepal. So this is the time we can convince people from different local government, provincial government, as well as federal government for the treatment of healthcare waste management in large population. So there are issue of repair and maintenance, so it should be managed timely, so that we can manage waste management properly, and then improve hospital laundry system and interim option to manage hospital liquid waste as well, and strengthening use of technology and comprehensive programs should be initiated, and prevent adverse effect of inappropriate hospital and environment. Also include promotion of local products on healthcare waste management and waste, partnership between government institutions, partners, private sectors for effective and efficient environmental health, healthcare waste management and waste as an opportunity, because though we are in a problem, but it may be an opportunity because there are so many laboratory we have established. So this is an opportunity to strengthen the system. That is why, as I have already presented, healthcare waste management is also one of the top priority. So it should be an opportunity to for future as well. So these are some of my presentation. Thank you.
Thank you, Mr. Gadamani, for your informative presentation. I think it was informed that some specific guidelines are available, emergency guideline is available in your country, but still there are some challenges in terms of its implementation, in terms of technology, coordination, and private sector engagement. I think these are a common challenge for waste management in South Asia. Thank you very much for your contribution. Now, considering the time,
thank you very much.
I would like to invite Mr. Fayaz Ahmed Memon, Deputy Director, Ministry of Climate Change, Government of Pakistan. Mr. Fayaz, the floor is yours. Can you hear me?
Thank you very much. Yes.
Please.
Thank you very much. Thank you very much. Yes, there's an issue of camera in my laptop, so couldn't you will see me. Distinguished heads, are you listening me?
We are hearing you. Yeah. We are hearing you.
Yes. Distinguished guests, Assalamu alaikum and a very good afternoon to all. My name is Fayaz Ahmed and I'm a Deputy Director in Ministry of Climate Change. I would like to thank you for inviting me and congratulate to SAKIB, International Society of Waste Management, Air, Water and UNEP for organizing this webinar on waste management in post-COVID scenario in South Asian countries. Ministry of Climate Change appreciates the efforts of SAKIB being put in to highlight the issue pertaining to waste management in South Asian countries, COVID-19 virus, which we are all facing. COVID-19 pandemic has directly impacted the waste management and disposal sector. Waste disposal is a key part of pandemic planning and recovery that we must get COVID-19 outbreak. COVID-19 is spreading around the world. Governments in several countries are focused on the questions to how to improve medical waste disposal. The subject of medical incinerators at hospitals is a key part of the question. Medical waste is one of the most dangerous form of the waste, especially if it is untreated before disposal. Medical facilities process many types of waste from hospitals, including consumable items such as gloves, protective gears, and of course biological waste. These items are light but bulky. Many Asian developing countries lack proper facilities, regulations for the handling and disposal of medical hazardous waste. Hazard waste is often openly burnt or mixed with municipal solid waste, illegally recycled and resold posing significant threat to both health of the handler and the environment. When medical waste is treated, it is often in old and inadequate facilities with limited capacity and guards. Outdated facilities should be modernized to avoid the emissions of toxic gases and generate clean energy from the waste. Most of Asia do not have the capacity to modernize their system by rolling out mobile medical waste treatment facilities. Are you hearing me? Can you hear me?
Please go ahead. Please go ahead.
Sorry, can you?
Faiz, please go ahead.
There is a need. Yes. There is a need for medical waste regionally. This can be achieved through a strategy for introduction and commercial deployment of new technologies across the waste value chain. This is the Pakistan case. In Pakistan, waste management under and burden challenge in Pakistan already faced with the lack of the capacity, adequate funding, resource, and research for the waste on scientific ground. Hospital waste management rules 2005 in place, formulated under Pakistan Environmental Protection Act 1997. These rules focus on the issue of biometric waste. Hospitals and health facilities in ICT, not elsewhere. COVID-19 related waste generated in hospital as well as household, residential, and commercial areas. Need of comprehensive guidelines or waste management plan to tackle this newly emerged issue. Next, please. Clean Green Pakistan Cities Index program is a barometer to judge overall in the country. There are 5 components. There are 5 components of this program: tree plantation, solid waste management, liquid waste management, total sanitation and hygiene, safe drinking water. Under this initiative, municipalities are tackling the capacity building training being conducted for the municipal workers for the solid waste management and collection of this COVID-19 waste. There are guidelines COVID-19 related waste management in Pakistan. The key recommendations of these guidelines are: COVID-19 related waste required separate handling, use of double layered bag for the waste collection from COVID-19 wards to control leaking, installation of separate bins inscribed COVID-19 waste, placing of COVID-19 in temporary storage place to cut the chance of infection before handling it over to waste collection staff. Disinfection of COVID-19 waste with 5% chlorine solution and public awareness at all levels. Pakistan Environmental Protection Agency is a technical arm of this ministry, has issued the advisory to all public and private hospitals, including EPS, for handling this solid waste. These covers the medical waste which is collected from the COVID-19 designated hospitals in ICT, Islamabad Capital Territory, should immediately be transported to a designated place for hazard-free removal as part of the efforts to control the spread of the disease under waste management 2005. COVID-19 medical infection collected from designated hospital and centers. All bags of the medical waste should be double bagged and packed and immediately in the incinerator with a temperature of about 1.150 degrees Celsius, and if possible in cement kilns as alternate option. The high temperature, strong alkaline and high prevent the production of gases throughout the process. COVID-19 waste container drum trucks should be enclosed to transport the infection medical waste. 2005 should immediately activate its team and for waste management plan, compliance to be given priority to handle and disposing of the medical waste related to the coronavirus and items belonging to the patients needs to be properly disposed of, including the bedding lines, clothes, etc. Meanwhile, closely monitor the situation in other regions in order to prevent environmental risk and support the war against the coronavirus. There are some way forward of my presentation. In collaboration with SAKE members, sharing of lesson learned, technology transfer for better COVID-related waste management, identification of potential funding channels to support tech and scientific among the SAKE member countries, sharing of success stories regarding COVID waste management practices. That's all from my side. Thank you very much.
Thank you, Mr. Faz Ahmed, for your presentation and considering the time. As we are running out of the time, I will be inviting from Sri Lanka, Ms. Jaya Sikara, Director, Solid Waste Management, Central Environmental Authority. Ms. Jaya Sikara, floor is yours. Considering the time, I would like to invite you to limit your presentation for 10 minutes. Can you hear me? Is she available?
Ipshita, she is there?
Not sure, sir. I couldn't see him in the participant list.
She was in the at the
Yeah,
beginning.
she was.
Beginning, she was there.
She was there. Yeah.
She is already there. Maybe
she is there. Okay.
Okay, Jessica, can you hear me?
Hello?
Yeah,
yes.
She's there.
Yes. Please share your PPT. We are not hearing you. Yeah, it is visible now. It is visible now. You can go ahead. Please start your presentation. We are not hearing you.
Professor Ghosh, I'm Ipshita. Ipshita speaking. I couldn't see her in the participant list.
She's there.
You may check.
But she's there. She is there. She is there. She is trying, but we could not hear. So
No, the presentation was shared from Rahul's side, I think.
Oh, I see. Okay. You are sharing
that's
it.
Why
It's all right.
Yeah.
But
That's
I request Sarojini to please unmute your microphone and speak, because we have already shared your PPT on the screen. Unmute your microphone. We can't hear you.
Can you hear us, Sri Lanka? I think there might be a problem of
Sir, I think Sarojini Jayasekara, she has arrived.
so if she is not available, we can move to next speaker.
Yeah, next speaker.
So I would like to invite Mr. Dorji, Chief Environment Officer, National Environment Commission of Bhutan. Mr. Dorji, the floor is yours, but I would like to request Sri Lanka to be prepared for the next session, for the next round.
Excellent.
Mr. Dorji. This is why we were inviting all panelists to attend the trial meeting. Was very important. Mr. Dorji.
Mr. Dorji is in the list, Ripshita?
Yes, sir. Yes, sir. He is in the list.
Yes.
He became present now, yeah, but we don't know where he is.
He was here some time back, but
Okay.
Mr. Dorji is not hearing us, I think.
So can we check once again that Sri Lanka is there or not? Yes.
So if Sri Lanka is ready, Sri Lanka can go ahead.
But I saw Sarojini now arrive a few minutes back. Where is she?
Sarojini has sent a message saying she can hear us, but I think there's a problem in her microphone.
Oh.
In the chat box, she had sent. Yes.
I can hear you all. Yeah.
Sarojini?
So what should we do if the problem is continuing like this?
Dr. Basir,
yes.
Should I suggest? Yeah, what we can do is, because we are already delayed, we can switch over to the panel discussion and hand it over to Prema Kumara, and if meantime they can settle it down, so we can take them in the panel discussion also for their presentation, if it is at all possible, if they are available.
So I think this is the only way forward that we can follow.
Yeah.
It's better to go to the next session.
Is that okay? Is that okay for now? You can you hear me?
Yeah, Sarojini. Yes.
Yes, we are hearing you. Yes.
Sarojini Jayasekara has arrived.
Yeah.
Please share your presentation.
Yeah. Then I have to on the screen. No?
Yes.
It is
Rahul, share the screen. Ipshita, share the screen with her.
Okay.
Or should you present?
Yeah, okay.
Sarojini, let them present.
Okay?
Let them. No. Let them make the screen for you. And Rahul, can you make the presentation from your office? Rahul or Ipshita? Anybody? As you did it
Yeah,
earlier?
Rahul is doing, I
Yes,
think.
sir.
Okay. Sarojini, your presentation will be made here. You only go on speaking and say change. All right?
Okay. Thank you. Thank you for support.
Rahul, please share the presentation. Yeah, of Sri Lanka. Yeah. Mhm.
Screen එක දැන් මම අරක ඉන්නේ නේ ස්ක්‍රීන් එක එනවා
සරෝජනී ඔය ස්ක්‍රීන් ප්‍රෙස් කරා නම් හරි.
ඒක මම ප්‍රෙස් කරා.
ඔව්.
ඉතින් එන්නේ නැහැ.
දැන් ඔන්න තියෙනවා. දැන් ඔයාලට ප්‍රසන්ට් ඔයාලට පේන්නේ නැද්ද?
Make the full
දැන් මට පේනවා.
right. දැන් ඔක කොහොම යන්න?
Okay. Okay. I'll tell you the next, then you can pass it on, no?
Please go ahead.
Okay, thank you. Thank you. Sorry for so much disturbance. And
No problem. Please
so
start.
I want for you all, I mean that is well matched with the COVID-19 scenario, the best greeting.
Hello.
The way
দিদিকে
of,
কল করে অ্যাড করো তো ও কি ওই মার্কসের সম্বন্ধে কি বলবে?
can you hear me?
Please. Yeah. Please mute.
Yeah. Actually, that I have to salute our health staff, health department, and the defense sector because of that combating and their tireless effort on combating the COVID-19 in Sri Lanka. So actually, in the operations that we have worked on through a presidential task force appointed well ahead in combating this pandemic situation. So that I'll concentrate on that the contaminated waste and the general waste, the waste categories that we have to address today. And more importantly, the COVID-19 contaminated waste from hospitals and labs. And we have quarantine centers that all the first and second contact people have taken and then quarantined, and as well as households and also early stages, few lockdown areas, and general waste from quarantine houses. Next, please. Next slide, please. Next slide. Okay, thank you. And actually, in the first category, the contaminated waste from hospitals. Actually, that we have confined the COVID treatment or the COVID contaminated patients to identified hospitals where the facilities are having, because we are practicing our regulations on healthcare waste from 2008, and at the moment almost I think all the hospitals are connected with some facilities of disposal. Some of them have in-house facilities, some of them are connected with the cluster-based facilities, and also we have a commercially operated licensed facilities for treatment of hospital waste. So with the increasing of numbers of COVID-19, we have to have some identified periphery hospitals to treat COVID-19, but ensured proper disposal through connecting them with reliable disposal mechanism. And also the other category, that waste arising from labs, testing labs, that is connected with the licensed commercial facility to ensure the proper disposal with all the precautions and guidelines and SOPs adopted by the health authorities. And staff are not contaminated with the COVID-19 yet. Next, please. So that is the COVID-19 healthcare waste, because we are having all the segregation and all the things practiced, so we were safe in that sense. But the more importantly, the general waste from the quarantine houses and other general public. So actually that I have to thankful to the Waste Management Authority Western Province. So they have had an immediate instructions compiled and dispatched to the local authorities how to handle the waste from quarantine houses and how to distinguish it from the or the segregated it from the general waste. So basically we are advising all the local authorities to segregate their waste into three: degradable, recyclable, and residual waste that has to be disposed. And with the COVID-19, we have another category of waste like special waste that is contaminated with COVID-19, suspected or quarantine person if they are in their house. So they have to categorize and segregated his or her waste separately and treated according to the instructions given. Based on the instructions that compiled by the Waste Management Authority, Western Province, later on, most of the stakeholders got together: the Minister of Environment, Minister of Local Government and Provincial Councils, Minister of Health, CEA, Waste Management Authority, and academia and expert in the sector. So they refined it further and published at the mid-April as the interim guidelines for management of solid waste generated by household and places. So I would like to share the main points of the that guidelines, because I think that is will be useful for the others also. So in the first foremost, so once identified the suspected or the person to be quarantined, the health authorities should inform to the local authorities, and they have a kind of identification system, labeling system, and they have put the notice in the gates of the houses. And as a principle, we try to localize the on-site waste handling and disposal if the space available in the houses, and if there's no places subjected to the quarantine, reduction, how to segregate it, and the special waste packing and all the instructions. So as I mentioned that we have to three categories in the food waste. If the particular household or the center don't have enough land space, they have to hand it over the kitchen waste to the local authority. After that, local authority will collect the keeping that waste in the same place after 3 days, because it now it takes 72 hours, that is well time to disrupt the COVID-19 virus if this place. And also if they have enough space, they should have a disposal pit or the composter, but it has to be disinfected. But you know that we have a very good opportunity as the Asian countries. We have a plenty of sunlight rather than the disinfections. So anyway, the disinfections for the household to be provided by the local authorities, and even non-biodegradable waste. So it is not necessary to collect it daily and in normal ways also. But here we preferably advise them to collect, if the space available, it has to be collected after the quarantine period. And if the space are not available, like the degradables, after 3 days, the local authority would collect the non-biodegradables also. Next, please.
Sarojini, you have 2 more minutes. You have 2 more minutes to finish it.
Okay, special waste from quarantine persons, that is the more important thing, and that has to be a special waste, has to be bag, leak proof bag. If that local authority provided a yellow bag, or they have, it is advised to have the yellow bags. If not, at least to tie it up with some cloth or some kind of a piece of strip in yellow, to identification purposes of the workers. And mustly double bag, and they have to keep the special waste for 3 days in well the place that cannot be reached the animal or children, and also have a plenty of sunlight. And the bags are disinfected before receiving by the collection vehicle, and the disinfected special bags are collected through the local authorities and disposed with actually that it is advised them to incinerate that waste. Next, please. So it is mandatory to incinerate, and the treatment methods in the disposal of collect special waste, and also if that for the moment almost all people don't have that kind of facility, and at least to be hand it over to the accredited clinical waste disposer for combustion. I think that we have recommended also to use their crematoria in this case if that other choice is not available. Next, please. And the other guidance, other main points that we have addressed in the guidelines is occupational health and hygiene, and mobilization of the people. More importantly, that how that worker should go to the home after completion of his work. So that also very much important to prevent the contamination of their home people. So, and also awareness and training was given. So if you, I invite you to go to this web link, and you can get more information on that interim guidelines that prepared in order to address, in order to manage that COVID-19 mineral waste. Next, please. So last slide is the challenges, and as all our colleagues mentioned, so we are in a trouble with that non-medical mask and the other personal protective equipments, the disposable items nowadays, because now all the people are advised to wear mask and other, especially the mask. So the disposal of the non-medical mask. So we are very fortunate that none of the COVID-19 patients are not reported from the society for a long time, but it doesn't say that we don't have COVID-19 patient in the society. Therefore, the health authorities still advise the general public to keep and follow their health instructions. So this is another kind of a waste stream that we are facing, and it's a very big challenge for all of us. I know that. And then for that, of course, all the stakeholders, now we got together for last couple of weeks and prepared a kind of a guideline for to going for a safe reusable non-medical mask to wear the general public, because we are now reopening the country. So the school children and all the people, so we have to be safe of them, and the environment as well. The economically and environmentally, the reusable masks are useful. So we have prepared a kind of interim guideline, and will be finalized as a standard in the country. So in the positive side, you know that we all know that we are reduces the using of junk foods and outside dining and everything, and it changed our lifestyle, and a lot of people are now still purchasing bulk and reduces the packaging. But again, due to the hygienic issues, with the reopening, there's a trend of using single-use plastic, the disposables. So that is a challenge that we have to curtail at the beginning. Otherwise, it will be end up with another huge pile of waste. And for that, of course, now we are working on. And finally, that I would. In order to prevent the COVID-19, so I would still stress on the opportunity we all are having the sunlight. So even the health authorities, they have advised all the general public to expose all the belongings before use to the sunlight, and that I think also worked very well. So people were I think almost all are I mean that followed all the health instructions. So these are the things that we have done in a nutshell. I mean that there is a very big lot of people are involved in this issue, addressing the issue in Sri Lanka. So thank you very much. This is, I think that's my
Thank you.
presentation.
Thank you, Surajani, for your presentation. Despite challenges that you have, I think Sri Lanka is a very successful experience in terms of waste management and also in terms of controlling the spread of coronavirus. I congratulate you for this success. So now if Mr. Dorji is available, I would like to invite him. Mr. Dorji is available or not?
Yes, please. Yes, yes.
So please go ahead. If you're, yeah.
Okay. Do I have to pull in my slide myself, or is it done from the secretariat?
You can do it. You can do it. If it is easier, you can do it.
Screen. Open system preferences. What is that?
Meantime,
Okay.
I request all the participants to please make your camera on so that we can see everybody.
Give me 1 second, sir.
Please.
Where is that? Okay, can somebody help me pull the screen?
All right. Don't worry. Rahul, you please make the presentation from your office. Rahul Ipshita, you please make the presentation. Tinle, we are making your presentation. You just go on speaking and say next.
Rahul, are you doing?
So Ipshita
Hello?
is doing. Yeah, he's doing. Yeah. Tinle, please start.
We are not hearing you, Mr. Dorji. Mr. Dorji? Maybe your camera is, your mic is mute. Mr. Dorji, can you hear me?
He is offline, I think.
Can you hear me?
Oh, yes.
Yeah, now we
Hello?
are hearing you. Yeah. Please go ahead. Mr. Dorji?
You can please see if he has any problem. You can please see if he has any problem. Dorji has any problem, please see. Look into it.
Okay. Can you hear me now?
Yeah.
We can hear you. Please go ahead. Please.
Okay, thank you. There's some error happening. I don't know. Maybe because of the network or thing, but it keeps on exiting. Okay, let me quickly start with my thing. Thank you, Sake, for the conference and
Again, yes, problem.
Maybe connection problem. There is.
Yeah.
I think if it is not solved, it's better to go to the next session.
Yes.
I can see it here. I mean, like, it keeps on exiting. I don't know for whatever reasons.
Now,
Can everybody hear
we are
me?
hearing you. Yeah, we are hearing you.
Okay. So very quickly before it goes off again, I would like to thank Sakib and the colleagues, for the patience. So sorry.
Yeah, there is real problem at your end. So we can't hear you. So Dr. Basit, what I suggest, let him check his computer and let us start the next session. If he can manage, then he can come in the next session only.
I think the problem is a connection problem. So anyway, it's better to move to the next session. At any time that he is available, we can take his presentation during the next session also.
Exactly.
So now I would like to invite Dr. Kumara, IGS-CCET, to kindly moderate the next session. Mr. Kumara, the floor is yours.
Sutrita is there?
Okay, yes.
Yes.
Dr.
I would
introduction.
be introducing
Make the
briefly. I would be briefly introducing Dr. Prema Kumara Jagat Dikela Gamara Lalage, who is the Deputy Director, Senior Researcher, IGS Center collaborating with UNEP on Environmental Technologies, CSET, Sustainable Consumption and Production, Institute for Global Environment Strategies, IGES, Japan. He is a development planner, holds a PhD in management development from the Nihon Fukushi University, Japan in 2006. He has over 25 years experience in working with academic, government, non-governmental organizations, bilateral and international development programs. Currently, he works as Deputy Director of the IGES Center, collaborating with UNEP on Environmental Technologies, CSET, at the Institute of Global Environmental Strategies, Japan, and assists developing countries and cities in improving waste management in more sustainable manner. His work focuses on developing integrated holistic waste management strategies at national and local levels, application of participatory learning, and action methods to promote 3 Rs: reduce, reuse, recycle, and circular economy, resource efficiency societies, integration of formal sector and women participation in waste management, and linkages between waste and climate change as well as sustainable development goals. Dr. Prema Kumara, kindly moderate the section, kindly unmute, and please start the session.
Thank you, Dr. Sukrita. Your nice introduction. I'm sorry taking long time for that introduction. I want to clarify two things. One is I saw this session is 35 minutes. Is it still for 35 minutes, or we need to reduce because of this delay in the whole sessions?
You go ahead with 35 minutes. Kumara, you go ahead with 35 minutes. You take your time, no problem. We will finish by 2 to 5.
I understand. So then I know that this session is the last session, so it's going to be moderated by myself. So thank you again for everybody to wait in for the long day. But I'm very happy that this session we have very distinguished panels to this session, representing different areas with lot of experience in the waste management and these COVID situations. So let me first introduce, and I will ask all panelists to show their face in the when they are available. I would like to invite Dr. Mustaq Ahmad Mehmet. So he is a very senior staff from the United Nations Environmental Program from the regional office in Bangkok. Mr. Mustaq, are you available?
Yeah, I'm available, but unfortunately only for next 14 minutes because I pushed my meeting still, but it's still 3:30 here. So
yes,
yeah.
Thank you very much. So then my second panelist, Professor Sadan K. Ghosh, Jadpur University. I can see him. So Professor Ghosh, welcome to this panel. And
Thank you.
then we have Mr. Kasunobu Onagawa. He's a director of CCEP IGS. So Mr. Onagawa, are you here?
He is there.
Okay. So then we have Mr. Shiaul Haq, the Director of Department of Environment, Bangladesh. Mr. Shiaul, Director of Environmental Pollution Control and Chemical Management, Minister of Environment and Wildlife Resource, Sri Lanka. Mr. Verhara, are you here?
Sure. Can you hear me?
Yes, we can hear you. Thank you very much. So I think all our panel members are still waiting for us. So thank you very much for waiting a long day. So according to my program, I have given first to Dr. Mustaq for a small presentation from about the waste management from Mustaq's side. So can I give the first floor to Mustaq? After that, we will start the panel discussion. So Mr. Mustaq, please go ahead.
Thank you. Do I have right to share the screen? Says organizer to make you presenter.
You can make it. If Sridhar, please give him.
Yeah, just a minute.
Not yet. Okay, now
Yeah,
it's
you are.
Yes, sir. Just
yeah. Now it's coming. So can you see my presentation, please?
Yes.
Yeah, it's visible.
Okay, good. So let me go quickly because of interest of time. Basically, though we are looking on the both scenarios, one is that during the pandemic like COVID-19, but also post pandemic with a new normal situation. So that's where we are trying to see how we have to support the healthier and happier society for that. And so United Nations Environment Program came up with a comprehensive COVID-19 response. That's what we call working with the environment to protect people. And that has 4 important areas. And the first one is on the waste management. So I'm a global coordinator for that first one on the waste management, where we are looking on the quite a few streams, but for interest of time, I only touch on the 2 here today. One is about the plastics. Now we saw the different types of plastics, including the protective gears or the masks, gloves, and then also we saw lots of packaging waste, the online shopping. Then we saw lots of plastics with the food delivery and so on. So basically it went at the alarming situation. On the one hand, that plastic waste increased, and most of that also got the infectious or suspicious hazardous waste. And on the other hand, because of the fears, because of the lockdown, and because of the slowdown of the economy, the recycling of the plastic went down. So that created a vicious circle for the plastic waste management. And the number 2 I would like to address is the medical waste, which was the key for today's all discussions everyone brought in to see that how the medical waste is increasing. from the hospitals, but also from the households and so on. But the biggest challenging part, we already know that in most of the countries, even in the normal situations, the medical waste treatment, collection, storage is not at par. So with this increase in the medical waste, and also because of the lockdown situation and so on, it becomes more difficult. And that's why when we look at the Wuhan, where this pandemic started, the first thing they started was to start the medical waste treatment facility, additional facility. And that is what we see, that importance, that in any pandemic situation, anywhere, medical waste treatment is the key to even protect the spread of further virus or infections. Now, to talk about how to manage these situations for medical waste and plastic waste in the post-COVID situation, again, the whole scenario is on the one hand, SDGs, which remain there, or the climate change challenges, which remain there, and all our responses are have to be in line with that. And on the other hand, we saw that because of the middle income in our countries and so on, there was a lot of increase in the waste, in the plastics and so on. Despite of the lockdown, we saw the home deliveries, online shopping, there's a lot of medical waste and plastic waste and so on. So basically, the major challenges which we find still remain there are the regulatory frameworks, which are not yet updated, especially for new types of waste, including even the e-waste, the medical waste, and so on, and also the institutional arrangements and enforcement. That enforcement is quite lacking behind, and the private sector participation, that institutional arrangement is not yet fully there. Financing mechanisms, as we see that waste management is very expensive business, and it cannot be completely supported from the subsidies by the local governments or even the national government. So it has to be designed on the polluter pay principle or extended producer responsibility and so on. Then also the different business models that can not only be looking on the downstream, but also the upstream, that how we reduce the waste, how we take back the waste, how we create the green supply chain, recovering and recycling the waste. So those business models are very important for that. And then technologies and infrastructure, as we already discussed quite a bit, that our technologies and infrastructure, even for the normal or municipal waste, is not at par, and the medical waste lacking much behind. And then also the plastic recycling is not fully optimized. And in one way, it also creates further pollution because of a lack of the proper technologies for that. And the biggest challenge remains with the informal sector, even in the lockdowns, the infection challenges and so on, so that we have to look. And then also the behaviors like sustainable lifestyles during the pandemic, that how we can reduce our plastics, packaging, and so on. So when we talk about the priorities to be discussed, that what are the key areas of waste management system that is lacking, that we can require to strengthening, as we already discussed in previous slide, but how to do that. And one way is a South-South cooperation. In South Asia, like many countries have a different competitive advantages. Some has in the technology, some in the regulatory frameworks, some has the behavioral changes, some has the businesses, private sector. So it's good to have a South-South cooperation within South Asia and beyond the South Asia. And then also there's need to be the major policy support and investments for upstream and downstream. For example, Director General mentioned about the World Bank project for $40 million on the marine litter. That will provide a lot of investments upstream and downstream for the plastics and packaging. So there's a huge list of the UNEP toolkits, which we developed over the 2 years and tested in many pilot cities and countries. So all these available for you. If you need any of those toolkits, they can be downloaded. Otherwise, you can write back to me. Thank you very much.
Thank you, Dr. Mustaq, for your very short but very comprehensive presentation. So I hope that you can still wait with us a little more time to the discussions. So now I would like to start the panel discussion with our panelists. I also pick up a couple of questions from the list what the participants are raised. So first, let me go to Mr. Verahara from Sri Lanka. Like Dr. Bashir mentioned, so the experience in Sri Lanka is quite interesting to see. But in this panel discussion, I would like to see not what we quickly responded, but how we look at this opportunity, like as this COVID-19 is a kind of opportunity for the governments in South Asia to move forward in improving the waste management. Because as I mentioned in my presentation, in the South Asia already developed a roadmap for sustainable waste management and resource circulation. So I want to look at this situation, this COVID situation, and how the governments can more proactive in taking action to that direction. In that sense, I would like to ask from the Mr. Verahara, what is the government of Sri Lanka is looking at in the future to get any changes in the systems to improve the medical waste management in the country?
Thank you, Dr. Premakumar. And I think nature has teach us a nice lesson that the way that we consume the resources and the way they behave. And with regard to waste management, I think now we are getting more and more attention for the waste segregation and good, better waste management practices. I think we are working on one of the presenters correctly mentioned that there will be a tendency of increase in the plastic waste management due to this pandemic situation, and we are focusing on attention for the plastic waste management. And can I answer for your second question?
Yes, please.
Yeah, and then I think I think we have to have this kind of dialogues will be an opportunities for sharing the experiences in each countries and learn from each other. I think IGS and UNEP, those organizations can make the required platform for such knowledge exchange. And on the other hand, I think we have to pay, focusing on some attention for application of some product. As Sarojini mentioned that Sri Lanka was able to introduce a reusable mask instead of ordinary mask, which will increase the waste load added to environment. And this is a good. I mean, we have learned some good lessons from this pandemic situation. We have changed our reduced the traveling, and then we reduce the junk food, and this is an opportunity to get the attention of policymakers to increase the improved practices of waste management. These are the few things that come to my mind uh, while hearing to this presentation. Thank you.
Thank you, Mr. Verhara. So it's very, very good to hear that the government takes some kind of future directions, taking this opportunity situation as a pandemic as an opportunity. So that's what we want to start, and we want to work in South Asia. So now I want to go to Mr. Onagawa, because there were a lot of questions from the participants about your presentation on technology. They want to know actually this landfill, because currently we know that most of the South Asia is based on the landfill dumping situation. So this COVID situation make it more complicated because without proper disposal facilities. So they want to know your opinion about this landfill situation, how can be utilized proper disposal method in South Asia.
Okay, thank you for that. Were the point for the discussion. First of all, I'd like to repeat that we are preparing a report on the waste management in response to this COVID-19. We're covering all the parts of the world. In which we're introducing as one of the treatment technologies the landfill in lieu of incineration facility. I think incineration is the most commonly accepted treatment methods for infectious waste, but as you just correctly mentioned, not all the countries are equipped with such facilities. It is very much interesting that one of UNEP, the YouTube, program is showing the good point of landfill treatment as one of the most practically applicable or available technologies for final disposal. Based on that, the presentation, they say as far as if it is well operated, the landfill would be the most reliable technology for the treatment of infectious waste, following the technology of incineration. So, I'd like to suggest those people who are interested in the technology of landfill site or proper the management of landfill. If you are interested in, you will visit that YouTube site prepared by UNEP to learn what would be the point of proper landfill waste disposal. Thank you.
Thank you, Mr. Onagawa. So actually, we are very much looking forward. I think these documents may be very helpful for South Asian countries to learn, like Dr. Mustaq mentioned, to South cooperation, because we know that India are doing a lot of things in the new technology, like use the plastic into the clean. Anything Professor Ghosh want to add in the new technology, how to use for waste treatment?
Thank you, Dr. Kumara. Thank you, Dr. Kumara. The first thing which I want to add to Mr. Onagawa, though landfill is one of the acceptable process for picking up the COVID waste, you know that in all the countries in South Asia, it is a big challenge if we open for landfilling, because before landfilling there are a number of processes from collection to the landfilling site, and the handling of this waste is a major issue in all the 8 countries for the COVID waste. So in that way, at this stage, unless and otherwise there is a disinfection system of the COVID waste at any of the stages just after the segregation, landfilling is a risk-prone area with respect to the infection and the transmission is concerned. The other part, we were thinking also, the waste at this stage, it's best always for incineration, waste to energy, and co-processing. You know, for co-processing in India, we have taken a big initiative in 2018 so that each of the cement plants throughout the country can take up the waste. And now as the COVID waste has come, so instead of landfill, we can always go for the co-processing, because co-processing doesn't have any residue waste. Most of the residue waste is converted into the cement again, so it is productive. Only thing is that in disinfection, I had discussion with number of people who are the CEOs of different cement plants. They are ready to take up this issue and to take this waste. Only thing is that they are concerned about the disinfecting the waste before it enters into their premises. So that is the important. As of today in India, we don't have any cement plant who are taking up the COVID waste, but there are dialogues which are open. So maybe in long run, this is one of the solutions that cement co-processing in the cement plant. We have co-processing in the cement plant. Thousands of tons of waste are being co-processed in cement plant today. So in that way, that is also a positive side, that dialogue is open, and in near future there may be some solution which can come out of this co-processing in the cement plant. Thank you.
Thank you, Professor Ghosh. Very good explanation about what's happening in India, because I know that it is very helpful for other countries to learn from India when we develop that status of a report for the waste management. So India is getting a lot of policies and also actions on waste management, so other countries can learn. So now I would like to move to the Mr. Xiao Haq from Bangladesh, because we know these discussions, the plastic is one of the main issues came with this COVID-19. There is a changes to use more plastic rather than normal situation. So, but we know at the same time, Bangladesh is one of the first countries in South Asia. So totally ban plastic waste in their regulations. So I'm wondering whether still you are keeping that stand or any changes in these policies because of this COVID situation, and how you look at this COVID situation and the future in this plastic, like a single-use plastic ban in Bangladesh. So, Mr. Xiao.
Thank you, Dr. Kumara, and I fully associate myself with the views made by the distinguished panelists previously. I would like to flag in two issues, and the experience we have got over the last 3 months. We see that only 25% of COVID-19 infected persons get admitted to hospital or healthcare facilities, and remaining 75% of COVID-19 positive or suspected persons stay in home quarantine or home isolation, meaning that a huge amount of COVID-19 waste has been generated from the households. But we know that the hospitals, healthcare facilities, they have some sort of biomedical waste management system. But with regard to the community level, as households, we don't have any system to address this COVID-19 waste in a environment-friendly manner. So I feel that we now COVID-19 waste from hazardous are posing serious threat, risk to the public health and environment. And if you consider over the last 3 months in our South Asian countries, it might cross 100,000 tons COVID-19 plastic waste. Plastic waste means the plastic gloves, plastic masks, plastic materials they have used for COVID-19 treatment. And I think that since there are huge amount of COVID-19 plastic, we also heard from Onogawa and the Professor Ghosh that all international guidelines they don't actually encourage for COVID-19 waste for recycling. They encourage for incineration. But my point is that these waste, as the course has presented, the 70% of plastic waste are recyclable and only 30% are incinerable, meaning that we have more than 1,000 plastic waste out there in the environment, and we need to treat them in a way so that we can, to some extent, use this in a later period. Meaning that considering the short life of coronavirus, as well as utilizing the opportunities of large-scale disinfection process of COVID-19 plastic waste with combination of these solutions, whether we can consider controlled recycle of COVID-19 plastic waste. So I would like to hear from the panelists that whether we can go for installation, we can burn this to assets, or whether we can utilize these hundreds of thousands of tons of plastic waste for other purposes. We can recycle and we can produce the other plastic materials from this disinfected plastic waste, and we can actually use this, use the large scale disinfection process. We can actually in every cities, big cities, we can establish a large scale disinfection process. Then we can have the controlled recycle, restricted controlled recycle of huge amount of plastic waste that have been generated due to the COVID-19. So I feel that the families can shed their light on that. At the same time, I also feel that this is the high time to put greater emphasis on managing the household waste, since considering the amount, they are almost 80% of the waste of COVID-19 coming from the households. So it is a challenge. And you have rightly pointed out that Bangladesh put a ban on utilizing the polythene bags quite ago, but it is hard to implement. At the same time, our honorable High Court has made a direction to the government that we have to restrict the use of single-use plastics by 2020. So we are actually working hard on complying with this High Court verdict, but we understand that considering the amount of plastic being generated in general condition as well as in COVID-19 condition, they are huge. And I feel that as Professor Ghosh has rightfully pointed out, that we can utilize them in the cement clean or co-generators if possible. But my feeling is that it is a resource. Considering the 3R strategy, the plastic waste is a resource, so we should look this plastic waste into the similar consideration. Thank you, Dr. Ara.
Thank you, Mr. Shaul Haq, for your comments on the plastic issue. It's look like, yes, Bangladesh also facing the same like other countries in increasing the plastic waste because of this COVID situation. So yes, we need to look at how to, like Professor Ghosh's presentation, to from the separation, because if not properly separate at source, so it's cannot be used as a resource or it's go to the waste. So it is very important to look at in that sense. So it's give me, I'm not sure that there is still Dr. Mustaf is still with us, so he already leave. So I hope that he may be leave already.
Possibly he is not there.
Okay, so then let me take my last question. So when I look at that the today discussion, the presentation, so when we look at the medical waste management from the generation to the final treatment, so I feel in our countries mostly, especially India and Bangladesh, Nepal, all these countries, this is handled by our waste collectors or waste people who handle us. This waste is also very important for their health and the situations. So I would like to let it ask Professor Ghosh to explain a little bit about how, because it is not only this situation. Actually, when we're doing waste management, these informal waste collectors should be properly equipped with they handle waste in the normal situation also. But in our South Asian context, this job is mostly informal and they're not well organized, and this is not happen in the health like a proper manner. So this COVID situation make it more vulnerable, these groups. So how we can think about to change this informal role of informal sector in waste management in South Asia, looking this opportunity, how these groups can be more formalized and bring them into the formal system. So this is also, I feel, very important subject in when we look at waste management in South Asia. Professor Ghosh, you have any yeah.
Yeah. Now I'll come to the Indian perspective. You know that from 2016 we started Sarvekshan under the Swachh Bharat mission, and starting from 500 municipal cities or urban cities, we came up to 4,237 cities in the year of 2019 to make the waste management effective waste management in the cities. There are a number of questionnaire and also the parameters. So on the basis of that, one of the very important issue in that is the formalization of the informal waste collectors and the recyclers. But you know, that is one thing, and we have now quite a good number of informal sectors transformed into formal sector, and the workers, they are also having the wages, they have a wage structure, they have PF, provident fund, medical facilities, medical card, and many other things. But as far as COVID waste is concerned, I personally am not very much confident where the aspects of these 8 countries in South Asia is coming. Because I visited Bangladesh, I talked to many of the people in the waste sector in Bangladesh. I visited the landfill site, Bhutan, not Bhutan, Nepal, then Bangladesh and Sri Lanka. I'm not confident that even if we give the training to the waste handlers, and they will be able to handle the COVID waste very effectively, this is not the right time we have achieved. We have to research more and more. We have to wait. We have to have that disinfection, because disinfection is the most important thing. We don't know to what extent it is disinfected, if it is 32 hours, 72 hours, or 30 hours. So in that way, it will take some time in India as well as in other South Asian countries. So as of today, I don't know how to go about. There are many people who are working on this social issue as well as the waste collection and waste handling issue. So I'm quite sure that very recently there will be some process which can be evolved for specifically, because you know that behavior pattern of these 8 countries are totally different from the developed countries. So it is no doubt an opportunity for all these Asian countries to develop a robust and improved waste management system, taking into consideration the informal sectors into formalization. So in that way, this is also a scope for strengthening waste management system. Again, I am reiterating that handling COVID waste by the informal waste sector is still a big issue and big question for all the 8 countries, not only in India. So in that way, we have to think more and more. We have to work more and more for some time, and then something will be evolved, I'm quite sure. Thank you.
Thank you, Professor Ghosh. I got some understanding that the waste management in South Asia is something totally different from the waste management in developed countries. So we need our own model for South Asia. That's what I also learned when we developing roadmap for South Asia. So that model is more practical and at the same time all like a very low cost low cost systems, so where the all countries can be applicable in easy manner. So in that sense, I want to conclude this session, but before that, I want to give one round for every panelist to share one very shortly what they want to say at the end of this meeting, because to take out from this meeting. So can I go first, Mr. Onagawa?
Okay, thank you. Maybe 2 points. One is the preparedness for this kind of infectious waste. While we know that there are so many guidelines discussing a perfect way of waste management, it is true that our countries have not prepared well for this kind of a situation. But we have to understand COVID-19 may have a second wave, and also we may have similar coronavirus infectious diseases in future, like the case of SARS or MERS. So the important point is we have to be prepared for such a situation with improvement of the current condition. And another point is as was discussed by many people, the segregation, promotion of the segregation of the waste, not only for the infectious waste, but also as an routine matter to discuss ordinary waste management. Every waste management process would start from the good segregation, which will contribute to the reduction of the waste we have to handle, regardless it is infectious waste or not. So I'd like to highlight again 2 points: the preparedness for this kind of disease related waste, and also the importance of segregation at the source. Thank you.
Thank you, Mr. Onagawa. So may I ask Mr. Verher, what do you think about like a takeaway from this meeting?
Yeah. Can you hear me?
Can I ask Mr. Verher? Or he is not available? Can I go to the Mr. Haq?
Thank you. We understand that we have to live with the coronavirus for some time, as Onagawa has rightfully pointed out. And we have to establish the system in place in every country within this region. And I feel that as he rightly pointed out, that for separation and for collecting separately the COVID-19 waste, we have to follow and we have to establish a similar approach that we have been doing for general municipal solid waste management. For instance, in the roadside, we have waste management, waste garbage bin. So we have to have a separate another bin for COVID-19 waste in the roadside or in the designated places on the road. So similarly, with regard to the storage and collection from the households, we have to have a separate system so that they are not being mixed up with the general waste. And at the same time, with regard to the general municipal solid waste management, I feel that we have to consider the situation of mega cities in a way, in a different way, considering the cities, the medium-sized cities. So with regard to the mega cities like Dhaka is producing almost 7,000 tons per day. So in that case, it is we are actually facing serious difficulty in managing this waste with the conventional approach: waste to composting, waste to biogas, or waste to energy. Now we are actually considering whether we have to reduce the space for landfill site. So we are actually considering whether we can burn the waste and produce the RDF, reduce derived fuel. So and for medium city like 200 tons per day, they can actually go for composting, biogas production, or waste to energy. But mega city can also do waste to energy practices. But I feel that the since SACEP is actually formulating the roadmap for our countries, so they can consider these two cities, two situations of mega cities as well as the medium-sized cities in a different manner, in a different perspective. Thank you, Dr. Kumara.
Thank you, Mr. Park. So I'm wondering whether Mr. Verahara is still in the line or he is not available. So if not, I would pass the last not least to Professor Ghosh, your final words to take.
Thank you. Thank you, Pramay Kumara. It's a very educative panel discussion by the panelists and of course the speakers. I have specifically 4 points as a final comment. Number 1, effective segregation and technologies. Number 2, you know that we had disaster management throughout the country, throughout the world. Like Japan has a very good disaster management system, maybe to handle earthquake and flood. But disaster management with respect to handling such situation, I think it is not available in any of the countries throughout the world. So in that way, this is one of the scopes to develop a disaster waste management system for this pandemic situation of COVID, and maybe there may be some others. So this is also one of the very new scope. The third, you know that this 6 months have changed our behavior and consumption pattern. So in that way, this is also a good scope, because all the time we say that we have to change our consumption pattern, we have to change our behavior pattern with respect to the consumption of material, consumption of resources, and also generation of waste. So this is a good scope to revisit how we can change our behavior pattern and the consumption pattern. And the fourth, we have to find out the opportunities of business with this waste management and strengthen the existing waste management. Existing waste management in any of the countries in South Asia is not effective, very effective. So this is a chance. And government are spending a lot of money on the waste management. I was just referring that for 10,000 patients under one roof, government of India has made a COVID hospital in Delhi. And many of the government in different countries are also making this type of facilities. Similar way, we have to take the advantage of this situation to prepare and develop a very, very effective waste management system in the country. So all these 4 points, I made it as a final comment. Thank you very much.
So thank you very much, Professor Ghosh. I think all of three of your points, when I summarize, I feel it is very much in line with what the South Asia roadmap is proposed. Actually, it's proposed some sustainable waste management, at the same time sustainable production and sustainable consumption systems also. In that sense, most of the points that you highlighted are included in the reports. I think what's as countries agreed in Bangladesh last November. So this is the time to take this opportunity and start in implementing this South Asia roadmap and its target and actions. But that time we didn't face the COVID-19 kind of a situation. But this is a good opportunity, like Mr. Onagawa mentioned, and also Professor Kos mentioned. So when the national governments or the city governments will be made waste management plans, this resilience or this disaster or immediate actions to be considered in that plan, we call contingency plans, is part of that city or national waste management plan. So that's what I learned from your points. So I would like to conclude from here this session and pass to the SACEP, because SACEP in a good position to coordinate, because these actions in South Asia and also the coordination of the implementation of the roadmap in South Asia. They already taken some actions like a World Bank, like a larger project for the plastic waste action. So it is very much in line with our three of our goals in the plastic in that roadmap. So I hope that it is helped the governments to work on these the roadmaps guide like a targets and the actions related to the plastic waste. So I would like to hand over now to Dr. Basir for your final session and the conclusion.
Dr. Kumara, can you check please whether Mr. Durji is still available or not? If he is available, you can invite him to have some comments. At least for
just
1
a
2
bit.
minutes.
So anyone from Bhutan is available? I think no.
No. So at any rate, thank you, Dr. Kumaro, for moderating this panel discussion. I think this panel discussion was very informative and educative. I can say educative. It was very much fruitful. So as all of you know, we are running out of the time almost for 1 hour. But it is clear that we could spend a lot more time discussing this issue, and that our speakers have a breadth and depth of knowledge that could enlighten us all. But this does really need to conclude our webinar for today. Let me just extend the deepest gratitude to all participants from our member countries and other countries, as well as international partners including UNICEF, for joining us today and for their great participation, presentations, and great discussion. I was informed that more than 400 participants attended this webinar, which indicates the concerns and interests that associated with COVID-19 waste. This meeting was represented by all SACEP member countries except Maldives. I would like to take this opportunity to thank the national focal points of our member countries for extending their cooperation in this difficult time, nominating experienced government officials to participate in this webinar, where the governments are understandably and appropriately focusing on controlling the spread of the coronavirus and providing immediate medical and income support to those affected. As presentations indicate, we have best practices in handling our waste, but we still have many challenges in waste management that need to be addressed by the governments. Let me also thank IGS Center collaborating with UNEP on environmental technologies and the International Society of Waste Management, Air and Water for their active collaboration in organizing this very important webinar as a response to COVID-19 pandemic. We are waiting for the IGS guideline to be shared with the SACEP member countries. Today's meeting will provide us a very productive information for the developing and improving this guideline. And thanks to all of you listeners for joining us today. for supporting this new modality for doing this kind of panels. I think that we are finding new ways of talking about really important issues and coming as a scientific community and the public to be able to ask and answer a set of critical questions. I'm sure this session would support countries in managing the waste in a sustainable way during the COVID-19 pandemic and post-COVID-19 period. Finally, on behalf of SOCEP, I show the highest consideration and cooperation and would like to thank you all for your invaluable contribution to this amazing program. Thank you all. With this, I close today's webinar. Thank you very much.
Thank you. Thank you. Before we finally conclude, I like to once again remind you all regarding two announcements on behalf of ISWMAW. First, the 10th International Conference on Sustainable Waste Management towards Circular Economy, 10th Icon SWM-CE 2020 during December 2nd to 4th, 2020 to be held at Kolkata, India. I cordially invite the participating delegates to submit articles and join the virtual cum physical conference. Date of full article submission is 31st August 2020. Details will be sent to you in mail and available in our website www.iswmaw.com. To a COVID-19 compendium entitled Countermeasures will be published really soon. We cordially invite you to contribute chapters. The interested authors are requested to send your willingness with your biodata and an abstract of 250 words before 31st August 2020. The article has to be submitted by 30th October 2020. And finally, I wish to thank all the organizers, especially Professor Shadun Kumar Ghosh, President ISWMAW and Professor, Department of Mechanical Engineering, Jadavpur University. Thanks to Dr. Abbas Bashir, Director General SASEP, and Mr. Kazunobu Onogawa, Senior Fellow at IGS Japan. Special thanks to all the country representatives and Dr. Memon from UNEP. I would like to thank the Secretariat of ISWMAW, especially the administrator, Dr. Rahul Vaidya, Ipshita Shah, and Ms. Anaya Ghosh. Rapporteurs, Ms. Ipshita Shah, Ms. Anaya Ghosh, Mr. Saurabh Shah, Mr. Tejasvi Rana, Mrs. Shonali Rai Chaudhuri, Ms. Joyita Banerjee, and our IT coordinator, Rajashri Chakravarti. Special thanks to the Secretariat of SASEP and to specially Ms. Priyankari Alexander. And last but not the least, all the participants from 23 countries, a big thank you for attending this webinar and making it a grand success. Please send us your valuable feedback. Over to Professor Ghosh.
Thank you. Thank you. Thank you. It's already late, so I'm not to speak anything. So it is already concluded by Dr. Basir. So we will see you again. We will see you again very soon in such a webinar, either on COVID or any other very daunting issues. Thank you very much. So we can now leave. Bye-bye.
Bye-bye.
Have we taken final photo or not?
The recording can be stopped. Stop the recording.
Thank you very much.
Thank you. Thank you so much.
Stop recording.